What's going on, world? Welcome to the live here on this Friday. Yay! Hey, if you guys are just now joining, welcome. Hey, I'm going to give you guys some time to walk up in here. You guys know what we're doing. We're going to do NCLEX questions today. A lot of y'all are probably wondering, Kevin, why are you wearing a sweater? Bro, because it's cold as hell up in here. You know what I'm saying? So, once again, I appreciate everybody coming through the live. I look sleepy because I am sleepy, all right? So what I want to know is who you are, where you're from, where you're at in your nursing journey. I need 1,000 likes and I need 100 people up in here. If I don't have either one of those, as a matter of fact, I need both of those. If I don't, you get nothing. Just saying. Got some questions over here for y'all today. Y'all know we do these things in intervals. Don't be coming over here getting all this knowledge, being greedy, and not sharing it with somebody. Megan, your jacket. What's up, Megan? Sorry. What's up, Megan? How are you? Hey, so I had a couple of people that reached out to me, told me that they're taking their NCLEX or that they passed their NCLEX. Hey, so if you pass your NCLEX, you graduate school, whatever, let us know so that way we can give you guys your flowers, okay? Had a couple of people that said that my course helped them, the coaching helped them, this live helped them. So if there's anything that I've ever done that's helped, hey, come here. Let's give you all the flowers. What's up, city girl? I see you. Shout out to all 15 of y'all out here. Hey, y'all already know. Hey, make sure you guys share the live. All right. Stop being greedy. I need 100 shares. I need 1,000 likes. And I need 100 people up in here. What are we doing? If you guys are just now joining and you guys are new here, my name is Kevin. I am a registered nurse, BSN, if that really matters to you. I've been a nurse for almost 4 years. What's up, Andy? How are you? I worked ICU, OR, and PACU. I was in the Navy for 16 years and have my background is in education as well as the surgery aspect. So this is why I'm here, giving you all this love, giving you all this knowledge. So like I said, I want 1,000 likes. I want 100 people up in here. And if I don't have either one of those, then we ain't going nowhere. You know what I'm saying? We'll just sit here and talk. You know what I'm saying? So where are you or who are you? Where are you from? And where are you at in your nursing journey? All right. While you guys are doing that, let me know. Let me know what's up. Let me know what's up. What questions do you guys have? Hey, oh man, I guess you guys don't want no questions today. That's too bad. Shout out to Jamaica, New Mexico student nurse, I'm guessing. Nikki, Trujillo. Oh my God, I done messed your shit up. I'm sorry. I'm in the Navy going to online college for my certificate. Shout out to you. Oh yeah, I think you said you were going to message me. We were going to talk about something. James says, hoping to take my NCLEX soon. Either you're hoping or you're going to. Which one? How did you manage the Navy and nursing school? I had a really good chain of command. I was, right where I was supposed to be. Right place, right time, right haircut, right uniform, all that good jazz. My chain of command was super supportive of what I was doing. If you don't have a good chain of command that's super supportive while you're going to school, while you're on active duty, it's going to be very, very difficult for you. I'm not saying it's not doable, but it's going to be very difficult nonetheless. Shout out to all 65 of y'all. We're about to do NCLEX questions. I need 100 people. I need 1,000 likes. I need 100 shares. No one has shared it yet. Shout out to the NY. What is the most important thing to know about taking the NCLEX? Everything. And understanding that the NCLEX is a basic nursing competency exam about safety. That's the biggest thing that you have to think about. You have to understand, what are the most important things that you need to do for your patient before you go and move on. Remember, it's about critical thinking to make a safe clinical judgment. Shout out to y'all. Get me to 1,000 likes. Where my 100 people at? Patient safety. Yes, ma'am. There we go. Shout out to you, Brittany. All right. When did the workday end for the Navy? What time did the classes start? Listen, that would take forever for us to have a conversation about that. The Navy was all day, every day. You know better. It's a test of safety. Indeed it is. Yes. Took my NCLEX today and I feel like shit. Well, hey, you might want to go lay down, drink some Pepto. I don't know what you want to do. No, but that's okay. I'd rather you feel that way now than you felt the way you felt like that while you were taking your exam. All right. Well, we got 83 people up in here. Apparently nobody wants to share. There's 83 of y'all. Share it to somebody. You know what I'm saying? Becky with the good hair. I might like her. You know what I'm saying? Amanda, shout out to your NCLEX. You know what I'm saying? Share it to somebody. Nessa, what's the deal? How are you? All right, ladies and gentlemen. Y'all got me to 93 people. Hola. What is it? Noelia. There you go. Noelia. How are you? All right, y'all. Here we go. We are about to knock these questions out. Nessa, I'm doing good. And yourself? Let's go. We're doing it. All right, here we go. Here we go. Question number one. Question number one. The client with varicella will most likely have an order for which of the following medications? Is it antibiotic, antipyretic, and antivirals, or anti-coags? Hey, so these questions are from nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. I am more scared about the job after passing the exam. That's okay. You're going to go through imposter syndrome, and it is all a part of the process, okay? It is all a part of the process. What are we thinking? What are we thinking? Let's go. Hey, shout out to the homie, the A1 since day one, Nurse Amber, or Nurse Glamber, aka Nurse Amber. She is also an NCLEX strategist. Make sure you guys go over there and check her out and follow her if you guys already don't. Hey, her and I got a bunch of stuff coming up for y'all. And the correct answer is C. Yeah, we're going to be doing this all day long. All right, varicella is chickenpox. This herpes virus is treated with antiviral medications. Hold on. Sela says, I passed my exam last week. Good luck, everyone. Shout out to you. Is it Kayla? Not Sayla, sorry. Shout out to you, Kayla. Congratulations. Welcome to the greatest shit show on earth known as being a nurse. Congratulations to you. If there's a piece of advice that you could give to everyone out here taking their exam, ma'am, what would it be? And once again, congratulations to you. All right. So here we go. The website was nurseslabs.com. All right. Hey, that's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right. Dr. Awesomer's in here. Whoa, hold on. It says, what's up? Just started a second semester of nursing school last week. Shout out to you, Dr. Awesomer. All right, here we go. Question number two. The client is admitted complaining of chest pain. Which of the following drug orders should the nurse question? So if you don't understand this, reread it, such as it's asking about which one should the nurse question, meaning which one is incorrect. All right, all of them? Stop it. You got to give me one. All right, is it nitroglycerin, ampicillin, propranolol, or verapamil? What are we thinking? Hey, shout out to all 152 of everybody out here. We're doing NCLEX questions. We are on the road to 10,000 likes. If y'all want more than 10 questions, I need more than 10,000 likes. I'm just saying. If y'all only want 10 questions, cool. We'll just do that. We'll just do that and call it a day. You know what I'm saying? But I want to know also who you are, where you're from, where you're at in your nursing journey. You know what I'm saying? And if you're not a nurse, what are you doing here hanging out with us? Always remember that we meet people where they are on their educational level. We don't stifle nobody's thought process while they are here. If you get it wrong, that is okay. All right. I'd rather you get it wrong here than get it wrong when you go take that exam. All right. So shout out to y'all. Make sure you guys share the live as well. Here we go. Here's our answer in 3, 2, and the answer is B. All right. It's ampicillin. All right. There is no indication for an antibiotic such as ampicillin. Okay. Penicillin has been very effective against Staph aureus in the past. However, S. aureus has become capable of exhibiting resistance against the producing or against them by producing penicillin hydrolysin enzymes. All right. So that's part of safety and infection control. Andy says, this is my first live stream with Kevin. This is amazing. I'm glad you like it, Andy. Yeah, you're well on your way to becoming a nurse. Trust and believe me. As long as you participate in something that is like this, you're going to do awesome. Jade, I'm taking my NCLEX tomorrow morning and I'm so nervous. Well, Jade, you shouldn't even be here because this is cramming. So you're going to be nervous. It's a part of the process. All right. It's a part of the process, but you have been studying. You are very capable, just like the millions of people before you, to make this thing happen. Okay. So you can do this. You got this. Everybody here believes in you, and go and do your thing. All right. Here we go. Question number 3. Which of the following instructions should be included in the teaching for the client with rheumatoid arthritis? All right. Is it A, avoid exercise because it fatigues the joints? Take prescribed anti-inflammatory medications with meals, alternate hot and cold packs to affected joints, or avoid weight-bearing exercises. What do we think it is? What do we think it is? All right, everybody's telling me D and C. All right, shout out to y'all. Shout out to y'all. If you guys are just joining, we're on the road to 10,000 likes. Make sure you guys smash that like button, you guys share, and you guys follow. All right. Make sure you guys make those things happen. Hey, that's the trifecta. That's how y'all got to me. All right. I need other people to get to me like that. You know what I'm saying? You can't be hogging me. You know what I'm saying? Kevin loves everybody. You know what I'm saying? Here we go. Here we go. Here is our answer. Here is our answer in 3, 2, and the answer is B. All right, I'm on my Michael Jackson today, y'all. All right, here we go. All right, so take prescribed anti-inflammatory medications with meals. All right, they should be taken with meals to avoid stomach upset. Modifying anti-rheumatic drugs are initiated as soon as the diagnosis of rheumatoid arthritis is made. Okay, that's part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right, LPNs, you need to know the same content that RNs know. All right. Nurseslabs.com. These are free sets of questions. You guys can go over there and check them out for yourself. Listen, I'm giving you a resource. Whether you want to use it or not, that is totally up to you. I'm trying to get you into the routine. If you can come here every day at 5:30 Central Standard Time to get a study on with me, there should be no reason why you can't create your own study schedule for yourself. All right. I'm just letting you know. Here we go. Question number 4, a client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? AKA, which one of these orders is incorrect, right? That I would want to start asking questions about. All right, my man, the dude is in the building. Hey, we got a professional athlete up in here. Shout out to you, big guy. Go over there and do your thing. Is it meperidine, 1 milligram IM Q4 hours PRN for pain? Mylanta on that DJ Tanner, you know what I'm saying? 30 cc's Q4 hours via nasal or NG tube. Is it cimetidine, 30 mgs POQID, or is it morphine, 8 milligrams IM Q4 hours PRN for pain? What do we think it is? What do we think it is? Oops. Oopsie. Hopefully nobody saw that. Hopefully, nobody saw that. All right. What do we think it is? Shout out to all 163 of y'all. We are doing NCLEX questions. We got them off nurseslabs.com. You know what I'm saying? I just picked one of these batches and I'm just like, cool, let's go look at it. Let's see what we can do together. All right. As long as you guys are in the routine of getting your studying on, I'd rather you get it wrong here than get it wrong when you go and take your NCLEX. Okay. And so the answer is morphine. The answer is morphine, 8 milligrams IM Q4 hours PRN for pain. Morphine is contraindicated in clients with gallbladder disease and pancreatitis because morphine causes spasms of the sphincter of OD or ODI or OODD, however, right? So that GI obstruction is another important contraindication. It is also considered by many as contraindication to provide opiates to individuals that have a history of substance misuse, especially if a patient has had a history of abusing opioids. That's part of safety and infection control, which is 10 to 16% on the NCLEX exam. Oh, I didn't say that. The answer is D. You know what I'm saying? I need all of y'all to be on your Michael Jackson today, all right? Get your Michael Jackson on. Get your sing on, all right? So shout out to everybody that got that right. If you got it wrong, circle back. Make sure you guys understand the content. And think about it. How does somebody get acute pancreatitis, right? Think about that. All right, here we go. Question number 5. The client is admitted to the chemical dependence unit with an order for continuous observation. The nurse is aware that the doctor has ordered continuous observation because of what? All right, we're talking about chemical dependency. All right, so they could be alcoholics, right? They could be withdrawing from opiates, something along those lines, right? So is it A, hallucinogenic drugs create both stimulant and depressant effects? It induces a state of altered perception, produce severe respiratory depression, or induces rapid physical dependence. What are we thinking? What are we thinking? She's telling me B. Look, who is that? Is it Elysian? Look, Elysian, hopefully I said your name right. Yo, you understand the assignment. My man Jason is in the building. Mr. BSN is in the building. Shout out to you, my guy. Shout out to you. Thanks for joining as usual. All right, so what do we think the answer is? All right, what do we think the answer is? Shout out to all 250 of y'all. All right, here we go. Here's our answer in 3, 2, and the answer is B. All right, the answer is B. All right, hallucinogenic drugs induce a state of altered perception. All right, hallucinogenic drugs can cause hallucinations. Go figure, right? Continuous observation is ordered to prevent the client from harming himself during withdrawals. Adverse effects are extremely subjective with significant variability and unpredictability. Okay, one patient may experience a positive effect filled with bright hallucinations, sights, and sensation, increase awareness, own to mind expansion, and mark euphoria. All right. The positive spectrum of effect is a colloquial. Oh my God. Y'all know what I'm talking about. Called a good trip. That's part of psychosocial integrity, which is 6 to 12% on the NCLEX exam. Smaller section. But listen, with psych, we're talking about safety, right? Safety of the patient, you, and others. Open communication, therapeutic communication, good open questions, keeping them talking, and good therapeutic communication. All right. So shout out to all of y'all for getting that answer correct. All right. Hey, ladies and gentlemen, I need for y'all to go to the link in my bio and go get you that free download. Me and Nurse Amber, aka Nurse Glamber, my A1 since day one, created a downloadable free PDF for you guys of understanding the client needs for the NCLEX. It's a step-by-step guide to help you understand what the NCLEX is going to be asking. A lot of people ask, what is the largest section on the NCLEX? Well, the largest client needs section on the NCLEX is management of care. The second largest section is pharmacology. LPNs, if you are taking your NCLEX, the largest section is coordinated care. All right. Second largest section is pharmacology, so on and so forth. All right. So you guys go over there and go get that free download. All right. It's like 5 pages, talk about those important things that you need to know. All right. It is literally when you go to the link on my bio in the link tree, it is the very first one that is right there looking you straight in the face. So go ahead and download it. You know you want to. All right, here we go. Oh, and also, ladies and gentlemen, my 7-day NCLEX course. All right. Hey, Memorial Day is upon us, right? Celebrating those who have made the ultimate sacrifice, right? To do things right, by us. All right. And as a token of that for y'all, I'm going to give you guys a discount, 20% off of something that's already cheap. All right. Go over there to the website, debootnurse.com/special with using that code right there. Memorial Day 2024 will get you an additional 20% off. So go ahead and go over there and get that. And by the way, it is for a lifetime access. I'm just saying. Here we go. Question number 6. A patient arrives at the emergency department complaining of mid-sternal chest pain. That is what we call recognizing a cue. All right. That is what we call recognizing a cue. Which of the following nursing actions should take priority? All right. Is it a complete history with emphasis of preceding events, an electrocardiogram, careful assessment of vital signs, or a chest exam with auscultation? All right. Let's think about that. Let us think about that. Let us think. All right. We got a bunch of people screaming B at me. Oh, hey, shout out to everybody that's just now joining. Hey, I got these questions off of nurseslabs.com. I did not make these questions. They're off of nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. We're on the road to 20,000 likes, y'all. We're on the road to 20,000 likes. All right. Don't be greedy out here. Like and share with Becky with the good hair. You know what I'm saying? Share it to her. I don't care if you don't like her. I don't care if she stole your man or your girlfriend, whatever. You know what I'm saying? Share it to her. She might like me. Her and I might be cool. You know what I'm saying? Stop being weird. All right, here we go. All right, here we go. Here's our answer. Here's the answer in 3. Somebody said definitely C. Cool. In 3, 2, and the answer is definitely C. I want to careful assessment of vital signs. All right, so the priority nursing action for a patient arriving at the emergency department in distress is always an assessment of vital signs. All right. This indicates the extent of the physical compromise and provides a baseline by which to plan further assessment and treatment. Monitor vital signs every 5 minutes during the initial anginal attack, right? So that recognizing cue is essentially saying that my patient, they have chest pain, right, of some sort, possibly having an MI, right? So think about that. All right. So blood pressure may initially rise because of the sympathetic stimulation, then fall if cardiac output is compromised. Tachycardia also develops in response to the sympathetic stimulation and may be sustained as a compensatory response if cardiac output falls as part of physiological adaptation. My man Khalil, Mickey Mouse, the man is in the building. My guy, I appreciate you. Love you, bro. All right, physiological adaptation, 11 to 17%, making it the 3rd largest section on the NCLEX exam. LPNs, you need to know the same content. Physiological adaptation consists of acute, chronic, right, of pathophysiology, the disease processes and how they affect the body, right, and medical emergencies. You know what I'm saying? Those are the things that you have to know. All right, remember, this exam is about basic nursing competency, safety. Can you safely recognize these things and take care of this patient? Lentz, thank you for the spicy little chili. Thank you, thank you. All right, here we go. Question number 7. The patient or a patient has been hospitalized with pneumonia and is about to be discharged. A nurse provides discharge instructions to a patient and his family. Which misunderstanding by the family member indicates the need for more detailed instructions? So the family members weren't picking up what I was putting down. All right. So what did they state that required me to give them further attention? The patient may resume normal home activities as tolerated but should avoid physical exertion and get adequate rest. The patient should resume a normal diet with emphasis on nutritious, healthy foods. The patient may discontinue the prescribed course of oral antibiotics once the symptoms have completely resolved. Or is it D? The patient should continue use of the incentive spirometer to keep airway open and free of secretions. Everybody's telling me D. Who is that? Is it TD? TD. I'm just going to call you TD. Thank you for the TGIF, my guy. Thank you so much. All right, what are we thinking? Or Shelby is telling me it's C. All right, shout out to you, Shelby. It's definitely C. Okay. Hey, y'all understand the assignment. That's what I'm talking about. Let's get it hyped up over here. You know what I'm saying? Let's get it hyped. Here we go. Here's our answer in 3, 2, and the answer is definitely C, right? It is definitely C. It is always crucial that patients being discharged from the hospital take prescribed medications as instructed. In case of antibiotics, a full course must be completed even after symptoms have been resolved to prevent incomplete eradication of the organism and recurrence of infection. Take antibiotics exactly as directed. Do not stop taking the medicine just because you are feeling better. That's what we tell our patients. All right. The client needs to take the full course of antibiotics as part of health promotions and maintenance. It says you have my daughter saying, my bad, Jenny. I'm sorry. Hey, health promotions and maintenance, 6 to 12% on the NCLEX exam. All right. Smaller section, lower section. But I'm telling you, they can pull different questions and make each category a subcategory within one question. OK, so if I gave you who do I see first, but it's a pediatric patient, we're talking about peds and we're talking about management of care. OK, so make sure you guys understand that. All right. Here we go. Question number 8. A nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Many family members are in the room around the clock using unusual rituals and bringing ethnic foods. Which of the following actions should the nurse take? I don't know if I would have used the word unusual, but y'all know what's up. User X12, you are welcome. Is it A, restrict visitors' hours or visiting hours and ask the family to limit visitors to 2 at a time? Notify visitors with a sign on the door that the patient is limited to clear fluids only, with no solid foods allowed. If possible, keep the other bed in the room unassigned to provide privacy and comfort to the family, or call the physician to report the unusual rituals and activities. What do we think it is? Shout out to all 114 of y'all. We are doing NCLEX questions. I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. If you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right. We try to foster up a good conversation and community down here in the chat. All right. What are we thinking? What are we thinking? Jenny's telling me C. Is it Vera? It's telling me B. Okay. Or Vara. Vera or Vara. One of the two. Thank you for the follow. Black for LPN. Appreciate you. All right. Well, let's see, y'all. Let us see what the answer is. It says RN board schedule for the 4th. Shout out to you, TD. You got this, my guy. And the answer indeed is C. Right? When a family member is dying, it is most helpful for nursing staff to provide a culturally sensitive environment to the degree possible within the hospital routine. In the Vietnamese culture, it is important that the dying be surrounded by loved ones and not left alone. Traditional rituals and foods are thought to ease the transition to the next life when possible. Allowing the family privacy for this traditional behavior is best for them and for the patient. It's actually part of management of care. You read the question too fast, which means you didn't read the question, all the way, Shelby. So what didn't you do? Tell them right now, Shelby. Tell them what you did not do. Management of care, largest section on the NCLEX. 15 to 21% for my RNs. Coordinated care, 18 to 23% for my LPNs. All right. That's the largest section on NCLEX, ladies and gentlemen. All right. Read the question. Yeah, you're forgetting a word, though. You're forgetting a word, Shelby. Go ahead and let them know. Let them know what word are we forgetting right now? You know what I'm saying? So shout out to y'all if you got it right. If you didn't, circle back. OK, it says I'm new. My name is Vicky and I'm starting my last semester in August. Shout out to you, Vicky. Shout out to you. Welcome to the live. We do these Monday, Wednesday, Friday at 5:30. So I'm glad that you're here. All right. Shout out to Jersey. All right, here we go. Question number 9. The charge nurse on the cardiac unit is planning assignments for the day. Which of the following is the most appropriate assignment for the float nurse that has been reassigned from labor and delivery? So what type of question do we think this is? Think about it. All right, think about it. All right. It says graduated on Wednesday from my RN program. Shout out to you. Is it Quee? Shout out to Quee. Do you love me? All right, here we go. The choices are A, 1 week post-operative coronary bypass patient who is being evaluated for placement on a pacemaker prior to discharge. A suspected myocardial infarction patient on telemetry, just admitted from the emergency department and scheduled for an angiogram. Is it C, a patient with unstable angina being closely monitored for pain and medication titration? Or is it D, a postoperative valve replacement patient who was recently admitted to the unit because all surgical beds were filled? What do we think it is? You guys telling me D. Shout out to all 111 of y'all out here. We're doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. All right, free sets of questions. Make sure you guys go over there and check those out for yourself. A little bit about me. I have been a nurse for almost 4 years. Next month on the 5th, it'll be 4 years. I worked ICU, OR, and PACU. I was in the Navy for 16 years, and I failed my NCLEX 3 times. Ladies and gentlemen, I failed my NCLEX 3 times. All right, and let me just tell you, it does not matter. It does not matter how many times you fail that exam. It doesn't matter how many times you take the exam. The biggest thing is that you need to learn how to understand this exam, show the compassion as well as the basic nursing competency safely in order for you to pass this exam. All right, get out of your own way. But the answer is, hey. I don't know if Michael Jackson said that, but hey is the answer. All right. The charge nurse planning assignments must consider the skills of the staff and the needs of the patients. All right. The labor and delivery nurse who is not experienced with the needs of cardiac patients should be assigned to those with the least acute needs. Right. So we want to give them stable, right? Just because they're a nurse, not all nurses are created equally. All right. I would not put a labor and delivery nurse on a patient that is sedated and intubated with 8 drips, right? And now they got to do vent management, head to toe assessment, and they got to titrate drips. I would never do that. All right. That is unsafe for the patient and for the nurse. OK, the patient who is 1 week post-operative and nearly discharged is likely to require routine care. Why? Because they are stable. All right. Management of care. Right. Management of care, 15 to 21%, making it the largest section on the NCLEX exam. Remember, management of care consists of priority, right? Staff management, delegation, supervision, assignments, right? That's a big part of NCLEX. Why? Because that is a big part of nursing. All right, here we go. Question number 10. A newly diagnosed 8-year-old child with type 1 diabetes mellitus and his mother are receiving diabetes education prior to discharge. The physician has prescribed glucagon for emergency use. The mother asks the purpose of this medication, which of the following statements by the nurse is correct. All right. Which of the following is correct? Cheryl, what's up? How are you? Welcome. All right. Glucagon enhances the effect of insulin in case the blood sugar remains high 1 hour after injection. Glucagon treats hypoglycemia resulting from insulin overdose. Glucagon treats lipoatrophy from insulin injections, or glucagon prolongs the effect of insulin, allowing fewer injections. What do we think? All right. Remember, diabetes falls under the endocrine system, right? Falls under endocrinology. Diabetes is a hugely popular tested subject area. Okay. Or should I say bee? I don't know, Felicia. Bye, Felicia. I'm sorry. You led me to that. Vara saying bee. Shout out to you, Vara. Shout out to you. All right, y'all. What do we think? What do we think it is? Hey, remember, y'all, I want y'all to get this license. I can't want it more than you. You got to put in the work. All right. It took me it took me 3 failures or 3 unsuccessful attempts and then 1 final successful attempt. Guess what? No one ever asked me. No one ever asked me how many times I failed this exam. No patient, no job, and they never will. All right. So get out of your own way. If you're nervous, don't be nervous. It's a part of the process. All right. All this is a part of your process. All right. And the answer is B. All right. The answer is B. All right. Glucagon is given to treat insulin overdose in an unresponsive patient. All right. Patients with decreased level of consciousness cannot safely consume oral carbohydrates needed to raise their blood sugar without risk of aspiration. And obtaining IV access can be problematic in diabetic population, which can prevent prompt administration of IV glucose. All right, that is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. So shout out to you. Oh, Naz is in the building, Miss Bougie herself. I'm just playing, Naz. Shout out to you, Naz. Shout out to you. You should be done with school now, right? You should be done with school now. Everybody should be on vacation, right? Kinda. But shout out to y'all. Make sure you guys do not understand this content. You circle back and you find the content for yourself, okay? All right, hey, ladies and gentlemen, once again, do you guys want a free PDF, right? Do you guys want some free knowledge? Like we're all about, I do these lives 3 times a week, giving y'all nothing but game. All right. Me, Nurse Amber, aka Nurse Glamber, my A1 since day one, is also an NCLEX strategist. And we created together Understanding Client Needs for NCLEX. It's a free PDF, right? A step-by-step guide for y'all. All right. A step-by-step guide. I can't wait to tell my story one day. I can't wait to listen to your story, Cheryl, because it's going to be a great one. All right. But hey, go over to the link in my bio. It's the very first one at top. Once you click the link tree and go download that freebie. All right. Go do that for yourself. Also, the 7-day NCLEX course, which is my on-demand NCLEX course right now, it's 20% off. It's already 70% off of whatever the original price is. And now for Memorial Weekend, I'm giving y'all an additional 20% off. All right. It is valid all the way until Monday. So go over there to the website, thebootnurse.com/special. Take the coupon code Memorial Day 2024 to go get you an extra 20% off. All right. Stop playing games. There's 80 videos and 2 NCLEX reviews over there. I don't know what y'all doing. All right. Here we go. Question number 11. An infant with congestive heart failure is receiving diuretic, not diabetic, but diuretic therapy at home. Which of the following symptoms would indicate that the dose may need to be increased? All right. What indicates, right? What sign shows, because these are signs, right? There's something I can visually see. Which one of these signs shows that the diuretics are not working? All right. Is it A, sudden weight gain? Is it B, decreased blood pressure? Is it C, slow, shallow breathing? Or is it D, bradycardia? What do we think it is? What do we think it is? Everybody's telling me, hey. All right. Everybody's telling me, hey. If you guys are just now joining, welcome, welcome, welcome. My name is Kevin. I'm a registered nurse, BSN, if you really care about that. I've been a nurse for almost 4 years. It'll be 4 years next month. I worked ICU, OR, and PACU, and I am your gracious host and teacher and instructor. This is what I like to do, so I appreciate you guys being here. I want to know who you are, where you're from, and where you are at in your nursing journey. Make sure you guys share the live, all right? Share the live. Get it on the For You page. I need people in here, right? I need to give people knowledge is what I do, all right? But the answer is hey. All right. The answer is A. All right. Weight gain is an early symptom of congestive heart failure due to the accumulation of fluid. Important among these are renal retention of fluid. Renin, angiotensin mediated vasoconstriction, and sympathetic overactivity. Excessive fluid retention increases the cardiac output by increasing the end diastolic volume or preload. Right, but also results in symptoms of pulmonary and systemic congestion. That's part of pharmacological and parenteral therapies, because we're talking about what the effects of what diuretics do. All right. We do care about that BSN. Okay, Naz. I feel like you just care about it because you're just like, I want to have the alphabet after my name because of blah, blah, blah. I'm just playing. No, probably. What's up, Nikki? You're from Omaha, Nebraska. You graduate August 10th. Shout out to you. Hey, that's right around the corner. You're not wrong. I know I'm not wrong. I know I'm not wrong because everybody wants that. You chase the alphabet, girl. You can look up the alphabet. You know what I'm saying? You can chase it all you want, smarty pants. I ain't mad at you. All right, here we go. Question number 12. A patient taking Dilantin or phenytoid, all right, for seizure disorder is experiencing breakthrough seizures, all right? A blood sample is taken to determine the serum drug level. Which of the following would indicate a subtherapeutic level? RN Cheryl Loden, I love it. I love to see it. Shout out to all 84 of y'all. What do y'all think the answer is? All right. What do we think the answer is? All right. We got C and C, Alina. All right. My man James is in the building. Hey, if anybody has ever wanted to understand how to create a digital product for themselves, you're looking for a side hustle, trying to make a little bit of extra money in this crazy world. Well, at least the United States that we live in. Go holler at my man James. Good guy. I can't believe I'm saying that. He's cool. He's cool people. Go over there and follow him. He is awesome, awesome, awesome guy. All right, here we go, y'all. What do we think the answer is? What do we think the answer is? In 3, 2, and the answer is B. The answer is B. B. All right. The therapeutic serum level for Dilantin is 10 to 20 micrograms per milliliter. All right. A level of 4 micrograms is subtherapeutic and may cause a patient noncompliance or increase metabolism of the drug. All right. That's part of pharmacological and parenteral therapies. All right. Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam for both RNs and LPNs. All right, at 13 to 19%. Even if the numbers are a little skewed, all right, and if I forget them, first of all, don't come for me because I will go off on you. Secondly, it still doesn't take away the fact that it is the second largest section on the NCLEX, okay, for both RNs and LPNs, okay? Here we go. Question number 13. All right. Hey, just because it's TikTok doesn't mean you're exempt from getting that ass cussed out. All right, here we go. A patient arrives at the emergency department complaining of back pain. All right. He reports taking at least 3 acetaminophen tablets every 3 hours for the past week without relief, which the following symptoms suggest acetaminophen toxicity. All right. Is it A? Is it tinnitus or tinnitus? Diarrhea, hypertension, or hepatic damage? What do we think it is? Shout out to all 85 y'all. I can only imagine if I was talking to 85 of y'all like in a room somewhere. I mean, it wouldn't be the first time. So Alina is telling me D. All right, well, let us see. Let us see what the answer is. Hold on. It says I passed my exam a few weeks ago. Thank you. These videos, they helped. Is it it's Osvaldo. Osvaldo, that's how you say your name. I don't want to mess it up, but shout out to you. Good sir. Shout out to you. Hey, right now, everybody, Osvaldo, his props. Welcome to the greatest shit show on earth, my good sir, known as being a nurse. If there's a piece of advice that you could give to anybody and everybody out here about your experiences and their experiences going into it, what would it be, sir? And once again, here's the claps. Congratulations to you. Congratulations to you. All right, here's our answer. Our answer is D. The answer is D. It is hepatic damage. It's I'm about to say acetaminophen is acetaminophen in even moderately large doses can cause severe liver damage that may result in death. Immediate evaluation of liver function is indicated with consideration to N-acetylcysteine administration as an antibiotic. Okay, that is part of that's part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right, Osvaldo getting all the love out here. That's what I'm talking about. Shout out to you, my good sir. I didn't see if you had put anything on there. I'll let him do his thing. All right. Hey, y'all. What we got going on over here works. Hey, what we got going on over here with Kevin the Boot Nurse Gibson It works. If it's not these lives, it's the one-on-one coaching. It's the on-demand course where I do a whole bunch of stuff, and it's the lives. All right. So if you guys want to be a part of that, make sure you guys are a part of that. All right. And go check out everything I got going on in the link tree. All right. Here we go. Question number 14. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which of the following nursing actions is most important in the client or in the care for this patient? Is it monitoring urine output, respiratory rate, heart rate, or temperature? Alina's telling me B. Alina, you're the only one that really understands the assignment because you're just you all into it. So I appreciate you. Yeah, I appreciate you. All right. What do we think? Everybody's telling me B. What's up, Samantha? Sam Obama's in the building, y'all. All right, y'all. Let's see what the answer is. Let us see what the answer is. Here we go. And the answer indeed is B. It is monitor respiratory rate. Morphine sulfate can suppress respirations and respiratory reflexes such as a cough. Patients should be monitored regularly for these effects to avoid respiratory compromise. Respiratory depression is among the more serious adverse effects of opiate use that is especially important to monitor in the post-operative patient population. That's part of pharmacological and parenteral therapies. Ladies and gentlemen, when people take the F word, the street pharmaceutical recreational drug or whatever they want to take, this is how they unalive. It's because they take the medication and it slows their respiratory rate down. So essentially, they end up suffocating. Why? Because they have ineffective tissue perfusion. They have no oxygen carrying anything going to the brain. Right? That's why it happens. Right? So understand it. I don't know if I'll get banned for fentanyl. Oh, anyway, so I said it. Here we go. Question 15. A patient arrives at the emergency department with severe lower back pain after a fall in a touch football game. All right. Following routine triage, which of the following is the appropriate next step in assessment and treatment? All right. Is it apply heat to the painful area? Apply an elastic Band-Aid to the leg, x-ray the leg, or give pain meds? What do we think it is? Shout out to all 80 of y'all. We're doing NCLEX questions. Y'all got me to 15,000 likes. Hey, we're on the road to 20,000 likes. Hey, if I don't get 20,000 likes, cool. I guess we're just stopping at question 20. I'm cool with that. We can do an Ask Me Anything after that. It's up to y'all. It is up to y'all what y'all want. All right. So what do we think the answer is? Also, I want to know who you are, where you're from, and where you're at in your nursing journey. Nolia says, see. All right. Is it forgiven? Thanks for joining. Appreciate you. D, pain is a vital sign. Oh, okay, Shelby. Take my NCLEX in 2 weeks. Shout out to you. Oh, we got another Samantha up in here. And the answer, it's C. It's C. All right, so following triage and x-ray should be performed to rule out fracture. Review follow-up and serial x-rays provide visual evidence of proper alignment or beginning callus formation and healing process to determine the level of activity and need for changes in or additional therapy. All right, physiological adaptation, 11 to 17%. 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Shelby, it's okay. Shelby, it's okay. All right. This is why it's important that we read our questions. We RTFQ, we RTFA, and we RTFR. Shout out to Zambia, Cheryl in Maryland. Shout out to you. All right. Third semester maternity and pediatrics. Jason, my man, you got it. You got it. Ladies and gentlemen, hey, go over there and go get you this free download, all right? Understanding the client needs for the NCLEX, all right? Understanding the client needs for the NCLEX. Free download. Myself and Nurse Glamber, aka Nurse Amber, created this download for you guys as a step-by-step guide of understanding the 8 client need categories for the NCLEX. You guys notice how I say, hey, this is management of care, pharmacological parenteral therapies, psychosocial integrities. That's what we're talking about with this download, all right? Go over there and go get that for yourself. Shout out to third term, all right? Hey, and also the 7-day NCLEX course, which is also linked in my bio, right? It's already 70% off at $97, right? For Memorial Weekend, use the coupon code Memorial Day 2024 to go over there and get an additional 20% off. You get it for a lifetime. However long your life is. It could be today, tomorrow. Ancestors be willing you last until like your 80s. You know what I'm saying? So go over there, Memorial Day 2020, use the coupon, go get it. And go get your learn on with 2 NCLEX reviews that are over there. All right, here we go. Question number 16. All right, the nurse caring for several patients in the cardiac unit is told that one is scheduled for implantation of an automatic internal cardioverter defibrillator, all right, which of the following patients is most likely to have this procedure? Abdullah, Newfoundland and Labrador, Canada. From Tanzania on my way to second attempt on NCLEX. Abdullah, I love that for you. I love that for you. Hey, you are delayed, never denied. Listen to me. If you've ever failed the NCLEX, you are delayed, you are never denied. All right. Just always remember that. You always can do this. All right. Is it a patient admitted for myocardial infarction without cardiac muscle damage, a post-operative coronary bypass patient recovering on schedule, a patient with a history of ventricular tachycardia and syncopal episodes, or a patient with a history of atrial tachycardia and fatigue? What are we thinking? What are we thinking? Denisha's telling me C. Naz is telling me C. City Girls telling me C. All right. Look like we have a general consensus of it being C. All right. Well, let us see. Let's see what the answer is. And indeed, the answer is C. Shout out to you, Alina. I appreciate you. All right. Hey, that is part of physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. Hey, that free download, we talk about it. All right? An automatic internal cardioverter defibrillator delivers an electric shock to the heart to terminate episodes of ventricular tachycardia and ventricular fibrillation, right? This is necessary in a patient with significant ventricular symptoms such as tachycardia resulting in syncope. Indications are usually secondary where the patient has already suffered and survived cardiac arrest due to ventricular fibrillation or tachycardia, or primary when the patient is at high risk of sudden cardiac death due to VFib or VTAC, but has never had any such event. Okay. All right. Because of that syncope. That's right. Right. And where does the syncope stem from? Due to ineffective cardiac perfusion. All right. If I'm not getting blood pumped to where I needed to go, then of course I'm gonna pass out somewhere. I'm gonna faint. All right. It's kind of how it works. Everything works in a specific manner, and we don't need it falling apart. Okay, here we go. Question number 17. A patient is scheduled for a MRI scan for suspected lung cancer. All right, which of the following is a contraindication to the study for this patient? All right. Is it the patient is allergic to shellfish, has a pacemaker, suffers from claustrophobia, or takes antipsychotic medications? What do we think? Melanie says A. Okay. All right. Nikki, Nolina is telling that. Okay. Grace is telling me A. Naz, what did you say before? Because whatever you said first, that's your right answer, and I'm sticking with it. So if it was wrong, I hope it's wrong. I'm just playing. All right, here we go. Everybody's telling me B, has some A's, has some C's. MRIs can't have metal, right? I don't know. I think an MRI, magnetic resonance imaging. So you tell me. Think about it. A lot of times, hey, listen. Your questions, your statements will literally give you those answers. All right. Alina's telling me B. All right. Well, we'll see. And the answer is B. All right. The patient has a pacemaker. There we go. All right. The implanted pacemaker will interfere with the magnetic fields of the MRI scanner and may be deactivated by them. The strong static magnetic field of MRI scans can attract and accelerate the ferromagnetic objects towards the center of the machine and turn it into a dangerous projectile. All right. Oh man, I got a crazy story for that one. I got a crazy story to tell y'all about when I took my patient down to the MRI. It was wild. All right. This magnetic field can also displace implants. Right. So if they have metal implants, it definitely can do that, or affect the function of devices such as pacemakers and pumps. That's part of reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the 4th largest section on the NCLEX exam. We are also smart. Naz, I like how you like to group everybody in there because you want to be included. You know what I'm saying? But whatever. No, I'm just playing. You say your energy is amazing. Bar, I appreciate you. I'm like this all the time. Most of the time. All right. Until Naz comes in here and starts bothering me. You know what I'm saying? I made her a mod. Why did I ever do that? I'm going to be in the NCLEX saying, hey, do it. Hey, whatever little things help you remember, stop it. Whatever little things help you remember, do it. Do it for yourself. Hold on. Who just came up here? Ashley. Ashley just came up in here, y'all, and told me that she passed NCLEX. First of all, Ashley, congratulations to you. To the greatest shit show on earth, known as being a nurse. Ma'am, if there's a piece of advice that you could give to everybody out here, ma'am, what would it be? What would it be to all the people that are out here trying to accomplish this goal? All right. And once again, congratulations to you. Y'all show her all the love right now. Right now. All right. RN Ashley. That's what I'm talking about. Or LPN or LVN Ashley, because LPNs and LVNs are nurses too. All right. Do not get it twisted. All right. The nurse calls a physician with the concerns that the patient has developed a pulmonary embolism. Which of the following symptoms has the nurse most likely observed? All right. Is it the patient is somnolent and with decreased response to the family? The patient suddenly complains of chest pain and shortness of breath. The patient has developed a wet cough and the nurse hears crackles on auscultation of the lungs, or the patient has a fever, chills, and loss of appetite. B. Rosie's telling me B. All right. Alina's telling me B, but Rosie's telling me B and she's not sure. So think about it. We're thinking about pulmonary embolism. So pulmonary meaning what? Lung, right? Embolism meaning that there's some type of blockage or clot that's going through our vessels, right? That's what we're thinking. Okay. So think about it. As those things start to move closer, what starts to happen, right? What starts to happen? Somebody says, breathe, listen to Kevin's tips. Don't overthink and stick to your gut. Ashley, I love that. I love that. I love that. I love that for you. And now you ain't even got to worry about it now. One thing, Ashley, I will tell you is that be a mentor to somebody else. Be a mentor to somebody else. All right, let's see what the answer is. Here we go. And the answer, somebody said, is traveling. So the answer is B. All right. A patient suddenly complains of chest pain, right, and shortness of breath. Typical symptoms of pulmonary embolism include chest pain, shortness of breath, and severe anxiety. The physician should be notified immediately. Pulmonary embolism occurs when there is a disruption in the flow of blood in the pulmonary artery or its branches by a thrombus that originates elsewhere or somewhere else. Usually it's like in the in your lower extremities. Okay. Usually. Chest pain is a frequent symptom and is usually caused by peripheral irritation due to distal emboli causing pulmonary infarction. All right, that's part of physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. Samantha says, do you have a lot of specific medications on the NCLEX? Samantha, to answer your question, the NCLEX will pull from a variety of different different medications. However, the ones that are taught are the ones that are asked the most are the ones that are asked more frequently that you need to be aware of. Your cardiac meds, respiratory, neuro meds, right? GI medications. There's a bunch of them that you need to know. All right. But you need to know the ones that are given out the most frequently. All right. I'm telling you, they ask cardiac meds a lot. They ask psych meds a lot. Okay. So here we go. Question number 19. A patient comes to the emergency department with abdominal pain. Workup reveals the presence of a rapidly enlarging abdominal aortic aneurysm. Which of the following actions should the nurse expect? Also, what should I expect? What should I see? Right? What should I see with regards to somebody having a AAA? All right. A patient will be admitted to the medicine unit for observation and medication. The patient will be admitted to same-day surgery unit for sclerotherapy. The patient will be admitted to the surgical unit and resection will be scheduled, or the patient will be discharged home to follow up with his cardiologist in 24 hours. Noelia's telling me, see. All right, what are we thinking? Shout out to all 76 y'all out here rocking. Y'all got me to 21,000 likes. Give me to 30. Give me to 30,000 likes. Let's make it happen. Let's make it happen right now. Right? Neow, Neow. All right. And if you guys are just now joining, my name is Kevin. I am a registered nurse, BSN, if that really matters to you, not you, Naz. Okay. And I worked ICU, OR, and PACU. I was in the Navy for 16 years, as well as I failed my NCLEX 3 times. And, now I coach, now I educate, and now I teach. It's what I like to do. I like to do it for y'all. I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? All right. What are you doing here hanging out with us? All right. And the answer is C. All right. The answer is C. A rapidly enlarging abdominal aortic aneurysm is a significant risk is at significant risk of rupture and should be resected as soon as possible. A AAA is a life-threatening condition which requires monitoring or treatment depending upon the size of the aneurysm. Okay. A AAA may be detected incidentally or at the time of rupture. Okay. Reduction of risk potential, which is 9 to 15% on the NCLEX, making it the number four, the fourth largest section on NCLEX, or for some of y'all, FO. Yeah, so there's that. All right, here we go. Shout out to y'all. If you got it wrong, circle back and get that content, okay? Here we go. Question number 20. Question number 20. A patient with leukemia is receiving chemotherapy that is known to depress bone marrow, all right? A CBC reveals a platelet count of 25,000 microliters. All right, which of the following actions related specifically to the platelet count, look, it even tells you, related specifically to the platelet count should be included on the nursing care plan. All right. So what does this number of 25,000 indicate? Right? What does it indicate when it comes to platelets? All right. So monitor for fever every 4 hours, require visitors to wear respiratory masks and protective clothing, consider transfusion of packed red blood cells, or check for signs of bleeding, including examination of urine and stool for blood. What do we think it is? Also, guys, don't panic if you get the full 150. My friend felt defeated but passed. Look at that. Hey, normalized passing at 150. Statistics show from the national board that people that pass at 85, the same percentage or about even of the percentage about the people that pass at 150 and everything in between. All right. The numbers are evenly skewed, right? Because it's all dependent on you because it is a computer adaptive test. OK. All right. She's like, dee I think. All right. Well, let's see. Here's our answer. Here's our answer in 3, 2. And the answer indeed is dee. Like mine shut off at 96. Look at that. Look at that. Shut off at 96. All right. Prepare. Listen to me, ladies and gentlemen. Here's another tip for you. I'm putting y'all on game. You need to be doing a minimum of 85 questions and a maximum of 150 when you guys are practicing. Nothing less than that. Why? I don't know who's out here telling y'all, yeah, just study 40 questions a day. Who the hell does that? Why? What are we doing? Prepare, know thy enemy. Your enemy is going to give you 85 questions. So go practice doing at least 85 questions, but max out doing what they could give you, which is a max of 150 questions. Stop playing with me. All right. Get off my phone playing. All right, here we go. A platelet count of 25,000 microliters is severe thrombocytopenic, right? And should prompt the initiation bleeding precautions, including monitoring urine and stool for evidence of bleeding. All right. So review lab values or the lab results for coagulation status as appropriate, such as your platelet count, prothrombin, INR, PT, APTT. All right. Fibrinogen. All right. Bleeding time, fibrin degeneration products, vitamin K, right. Or ACT or your active coagulation time. That's part of reduction of risk potential. All right. Reduction of risk potential, 9 to 15% on the NCLEX, making it the fourth largest section on the NCLEX exam. All right. So stop playing. Listen, this knowledge. This exam is about basic nursing competency. You need to be able to recognize what these things look like. You need to be able to recognize what these things look like and what these sections are going to be talking about. And that's exactly what this free download does. It tells you and gives you an understanding about what the 8 client needs sections are going to ask you. All right. Where they pull their questions from. It's a step-by-step guide. It's free. Myself and Nurse Amber, aka Nurse Glamber, right? NCLEX strategist, my homie A1 since day one. She and I created this PDF for y'all. So go over to the link in my bio, the link tree. It is the first one that is up there. Click it down. It's going to get sent directly to your email. It's going to get sent directly to your email. All right. So stop playing games. All right. Send that link to somebody else so that way they can get it if they need, sharing is caring. So go over there and get that for yourself. Also, ladies and gentlemen, the 7-day NCLEX course, which is my on-demand course. I have over 80 videos in there and 2 NCLEX reviews. The NCLEX reviews total over 8 hours. Total over 8 hours. All right. So go over there and get that for yourself. It's already discounted at 70% off at $97. And for Memorial Weekend, I'm giving you an additional 20% off. All right. So use Memorial Day 2024, right? Use Memorial Day 2024 at the checkout and get an additional 20% off, which is something that's already 70% off. All right. So go over there and get that for yourself. And you get access to it for a lifetime. Cheryl said, I did 120 yesterday. I did 96 today. My brain is fried. I'm still taking a small break with you. There you go. You have to be able to take a break. All right. You don't need to get sensory overload. All right. You got to give your brain time to relax itself. Okay. Here we go. Question 21. A patient is undergoing the induction stage of treatment for leukemia. The nurse teaches family members about infectious precautions. Which of the following statements by the family members indicate that the family needs more education? All right. So the family's not picking up what I'm putting down. So what type of information that I need to give to them for a patient who has leukemia? All right. Right. And we're looking at infectious precautions. All right. We will bring in books and magazines for entertainment. We will bring in personal care items from home. We will bring in fresh flowers to brighten the room. We will bring a family picture or bring in family pictures and get well cards. All right. Noelle. No, I keep wanting to call you Noelle, but your name is Noelia. Noelia. There we go. Noelia. Everybody's telling me C. C. Shout out to all. Oh my goodness. Shout out to all 74 of y'all. No flowers, please. Okay, I got you. You don't like flowers? You're not like a rose or a tulip, or you're not that kind of gal? You know what I'm saying? Oh, okay. I guess. Oh, you're talking about for the patient. Okay, cool. And you're right. You're right. We don't want to bring those flowers. If you ain't tapping, you're napping. Ashley, let them know. Let them know. Get carpal tunnel for me right now. All right. Get me to 50 shares. Give me the 50 shares. All right. Here we go. During induction chemotherapy, the leukemia patient is severely immunocompromised and at risk for severe infection. Fresh flowers, fruit, and plants can carry microbes and should be avoided. All right. Teach proper hand washing using antibacterial soaps before and after each care activity. Hand washing and hand hygiene lessen the risk of cross-contamination. All right, that is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Because the patient is neutropenic, you are very much correct. You are very much correct. Why? Because they don't have an army. They have no army, essentially, to fight off all the nastiness that this world decides that it wants to throw at them. Okay. I know no one cares about your spelling. I knew what you were talking about. All right, dude. You're not a 9-year-old on ESPN trying to win a spelling bee. I'm picking up what you're putting down. It's all good. All right. But shout out to y'all. Make sure you circle back to get that content. Okay. Here we go. Question number 22. The nurse is caring for a client with acute lymphoblastic leukemia. Which of the following is the most likely age range of the patient? What are we thinking? You're welcome, Cheryl. You're welcome. What do we think the answer is? Shout out to all 70 of y'all. We're doing NCLEX questions. Make sure you guys like, you guys share, and you guys follow. Make sure you guys like, share, and follow. All right. What are we thinking? What are we thinking? Nikki's telling me A. Abdullah's telling me C. Is it Furkan? Furkan, what did you say? Furkan said A. Jenny says, I think it's A. All right, Jenny. All right, what else? Christy is telling me C. All right, well, let's see. Let's see what the answer is, y'all. Let us see what the answer is in 3, 2, and the answer is A. The answer is A. All right, so peak incidence of ALL or all is at 4 years. All right, ranges from 3 to 10. It is uncommon after the mid-teen years. It is diagnosed in about 4,000 people in the U.S. each year, with the majority being under the age of 18. All right, it is the most common malignancy of childhood. The peak age of diagnosis is between 2 and 10 years of age. That's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right. Children get it. Indeed, they do. Children indeed do get said disease. All right. So make sure if you don't understand that, remember with physiological adaptation, pathophysiology, disease processes and how they affect the body. OK, that's just one other little tip and nugget I'm dropping on y'all. All right. Here we go. Question number 23. A patient is admitted to the oncology unit for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? All right. Is it painful cervical lymph nodes? Is it night sweats and fatigue, nausea and vomiting? Or is it weight gain? What do we think it is? For Con saying it's A. Okay. All right, what else we got? Jason's telling me A. What else we got? Khadijah. Sorry, I was thinking about living single just a second ago. I'm sorry. Because we're living single. All right, here we go. Here's our answer. No more of that nonsense. You're unsure? Hey, even if you're unsure, give me a guess. Because on NCLEX, remember, you can't skip a question. And then when you practice exams, you can skip. But I don't want you to skip. If you answer, you at least have a 25% chance of getting it right versus trying to skip it. All right? All right. Here we go. And the answer is B. It's B. All right. So let's talk about it. Symptoms of Hodgkin's disease include night sweats, fatigue, weakness, and tachycardia. Hodgkin's lymphoma, all right, formerly known as Hodgkin's disease, is a rare monoclonal lymphoid neoplasm with high cure rates. Our biological and clinical studies have divided these disease entities into two distinct categories: classic Hodgkin's lymphoma and nodular lymphocyte predominant Hodgkin's lymphoma. All right, that's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right, 11 to 17%. Yeah, you need to read up on it. That's okay. Read up on it. All right, read up on it because listen, you have to be able to realize what specific questions that they're going to ask you. Right. The whole thing is that you need to know what everybody else knows. You need to know what everybody else knows. All right. And if everybody else needs to know the recognizing cues of understanding vital signs that my patient is having, hypovolemic shock, that's what you need to know. Now, if I start going out into the weeds and I start talking about just crazy heart rate or heart rhythms on an EKG strip that normally they won't ask, I wouldn't necessarily be worried about that. OK, is a question 24. The Hodgkin's disease patient described in the question before, not above, sorry, but before, undergoes a lymph node biopsy for definitive diagnosis. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? All right. Is it Reed-Sternberg cells? Is it lymphoblastic cells? Is it Gaucher's or Gaucher's? Gaucher cells or Reader's cells? What do we think? We got A, we got B. Shout out to all 75 of y'all. Hey, I just want y'all to realize that there's 75 of y'all in here. If we were like in an auditorium somewhere, there'd be 75 of y'all staring at me. Ain't that weird? Ain't that weird? Perspective, baby, perspective. I appreciate y'all giving me the 30,000 likes. So guess what? I guess y'all are getting all 30 questions. Or do I have more? Who knows? Who knows? I could have more. I could have 75. I have done 75 questions on here before. So, all right, but let's see what the answer is, y'all. Let us see what the answer is in 3, 2, and the answer is A. Oh, Nolia, you just changed your answer. Look at that. Shame. Here we go. A definitive diagnosis of Hodgkin's disease is made if Reed-Sternberg cells are found on pathologic examination of the excised lymph nodes. All right, that's part of physiological adaptation, which is 11 to 17% on the NCLEX, making it the third largest section on your NCLEX exam. Ladies and gentlemen, when you are studying, study technique, when you go back and you start reading and reviewing your exam, first of all, everybody needs to be doing them. If they're wrong, you need to be reading them. If they're right, you still need to be reading them. All right. You still need to be reading them. Read your questions, read your answers, and read your rationales. RTFQ, RTFA, RTFR. All right, here we go. Question 25. A patient is about to undergo bone marrow aspiration and biopsy and expresses fear and anxiety about the procedure. Which of the following is the most effective nursing response? All right. So is it warn the patient to stay very still because the smallest movement will increase her pain? Is it encourage the family to stay in the room for the procedure, stay with the patient and focus on slow, deep breathing for relaxation, or delay the procedure to allow the patient to deal with her feelings? What do we think it is? What type of question do y'all think this is? What category do you think it falls under? Sometimes it's just that easy. Sometimes it is just that easy. Where do you guys think it follows? Where do you think it falls under? Therapeutic communication, therapeutic response. Okay. What category? I've been talking about the categories after each one, right? So what category do we think it is? And there's no right, there's no wrong answer with that. It's just all about understanding where these questions come from. Everybody's telling me, see. Well, let us see. Let us see what it is. And indeed, the answer is C. The answer is C. It is indeed a safety thing, right? But it's all about good therapeutic communication. Good therapeutic communication, right? Because I never want to discount a patient's feeling. Hey, they're having a bone marrow transplant. I think that's what it said. I'm not going back. Pretty sure that's what it said. No, bone marrow aspiration and a biopsy, right? Any type of procedure. You knew it. That's what I'm talking about. Any type of procedure people are going to be nervous for, right? So slow, deep breathing is the most effective method of reducing anxiety and stress. Anybody ever heard of guided imagery? That's a really good way to do it too. Hey, you're on a bed of clouds. Take a deep breath. All right. Hold it. Now let it out. Right. I've done that. It's weird. I mean, it's not weird. I actually enjoy it. And it helps people. It helps people. When I used to work PACU, I used to help people with that. All right. It reduces the level of carbon dioxide in the brain to increase calm and relaxation. Basic care and comfort. Right. Also think of psychosocial integrity. All right. Also think of psychosocial integrity. Both basic care and comfort and psychosocial integrity are both 6 to 12% on the NCLEX exam. You're so smart. All right. Here we go. Make sure you guys go. No. Kiki, you're really smart out here. So make sure you get that download to understand client needs for the NCLEX. All right, here we go. No more of that nonsense. All right. Understanding the client needs for the NCLEX. Hey, go over there and get you that free download. All right. Vara, don't do that. Don't do that. All right. So make sure you guys go over there and get that free download. We all are smart. Ashley, yes, ma'am. We all are smart. OK, make sure you guys go over there. Go get that free download. All right. I don't know how long it's going to be there. All right. I don't know how long it's going to be there. Go get it. Cheryl, my singing is terrible. Hey, once again, 7-day NCLEX course. Hey, Memorial Day weekend is upon us, showing the love and the respect to all those that made the ultimate sacrifice. All right. Remember, guys, I'm a veteran. I've been deployed twice. So, this is one of those holidays that are really near and dear to me for, some brothers and sisters of mine in arms. So for y'all, I want to give y'all an additional 20% off. So if you need an NCLEX course, an NCLEX review, go over there and go get that. Were you a corpsman? Yes, I was a corpsman. I was a corpsman while I was in the Navy. Usnavi, as we call it. You can't go wrong with free was helpful for me. I love it. I love that for you. Vara. Yud, kill. No, let me stop. Question 26. All right, you got me hyped now. Thank you for your service, Kev. We love it. Samantha, thanks so much. I appreciate you. Same got out last year. Love it, Vara. I love that for you. It's a different sense of freedom, isn't it? Vara, so here's a quick question for you. How have you adjusted being like out? How have you adjusted? All right. So a mother complains to a clinic nurse that her 2.5-year-old son has not yet toilet trained. She is particularly concerned that although he reliably uses the potty seat for bowel movement, he isn't able to hold his urine for long periods. Which of the following statements by the nurse is correct? It was smooth. Okay, that's good. That's good. I'm glad it was smooth for you. I'm glad it was a smooth transition. How you like civilians though? How you like them? It says I was the command career counselor, so I was said, I'm not worried about the career aspect. I'm just talking about dealing with folks. You know what I'm saying? I'm just saying. Just saying it be like that. Shout out to all 66 y'all out here rocking. We're doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check them out for yourself. If you're not tapping, you're napping. All right. If you're not tapping, you're napping. All right. 808 grown. What is that? Oh, that's Hawaii. We talked about that. Hawaii. What part of Hawaii you stay in? I can't remember. Did you say, were you on Oahu? Were you on Big Island? I can't remember. I was napping. Better wake that ass up. All right, here we go. The answer is C. The answer is C. All right. So toddlers typically learn bowel control before bladder control. All right. With boys, often taking longer to complete toilet training than girls. Readiness to begin toilet training depends on the individual child. In general, starting before 2 is not recommended. All right. The readiness, skills, and physical development that the child needs occurs between 18 months and 2.5 years. Was it Malachi? Oh, Malachi. Shout out to you. I had a buddy who lived in Schofield, who lived on Oahu, right? Health promotions and maintenance, 6 to 12% on the NCLEX. But he lived in Oahu, and we hung out there, and it was cool. It was a nice little trip. I went on all the hikes. It was great. Question number 27. The mother of a 14-month-old child reports to the nurse that her child will not fall asleep at night without a bottle of milk in the crib and often wakes during the night, asking for another. Which of the following instructions by the nurse is correct? All right. Allow the child to have a bottle at nighttime or at bedtime, but withhold the one later in the night. Put juice in the bottle instead of milk. Give 1 bottle of water at bedtime. Do not allow bottles in the crib. What do we think? What do we think the answer is? Naz is telling me D. Quant, I have not seen you answer at all. Have you been hiding from me all day? What are we doing? All right. Everybody's telling me D. Cheryl's saying D. Samantha telling me C. Okay. You're always with me? Well, you're always with me too. It's saying C. Naz saying D. I saw you, Naz. I seen you. I seen your answer. All right, here we go. Safety. Okay. Well, let's see what the answer is. Here we go. And the answer is C. The answer is C. All right. So the answer is C. Give only a bottle of water at bedtime. Okay. So babies and toddlers should not fall asleep with bottles containing liquid other than plain water due to the risk of dental decay. All right. All right. So wean 1 ounce a night. All right. Let's say the child takes 3 4-ounce bottles at night. All right. So take the last bottle and reduce it by an ounce. By an ounce on night 1. All right. And y'all can read the rest of that. Health promotions and maintenance. Yes. Health promotions and maintenance, 6 to 12% on the NCLEX exam. Hey, that free download, we talk about that. It's in my link tree. Make sure you guys go over there and get that. I should have known that. Oh, Lord. Lordy Lord. You got to know it. All right. So which of the following actions for question 28 is not appropriate in the care of a 2-month-old infant? All right. Place the infant on her back for nap time and bedtime. All right. Allow the infant to cry for 5 minutes before responding if she wakes during the night, as she may fall back asleep. Take the infant or talk to the infant frequently and make eye contact to encourage language development, or wait until at least 4 months to add infant cereal and strained fruits to the diet. What do we think it is? Shout out to all 64 of y'all. Shout out to all 64 of y'all out here rocking. We are doing NCLEX questions. My name is Kevin. I am a registered nurse, BSN, because apparently, I need to have all the alphabet, at the end of my name, like somebody suggests, right? Naz. It doesn't matter. You do care? Oh, stop it. No, but shout out to y'all. Hey, I would never stifle anybody trying to increase their education. You go do you. Trust and believe that. Why let the infant cry for 5 minutes? First of all, why not? You know what I'm saying? You know how I feel about these kids? I'm just kidding. Here we go. But the answer is B. Allow the infant to cry for 5 minutes, right? We don't want to do that. Do not do that. All right? Do not do that. All right, infants under 6 months may not be able to sleep for long periods of time because their stomachs are too small to hold adequate nourishments to take them through the night. After 6 months, it may be helpful to let the baby put themselves back to sleep after, right? But before, absolutely not. So we don't let babies cry like that. We don't let babies cry like that. Because you got to think, when they cry, it's their only way of communication. It's the only way that a baby or kids that obviously can't speak to you, their crying is their way of communicating with you. Okay. Health promotions and maintenance, 6 to 12% on the NCLEX exam. Smaller section, but of course, very important. Remember, they can loop categories together. They can put categories together. So management of care and pharmacology, pediatrics, pharmacology happens all the time. All right. So you have to understand what your role is when it comes to taking care of your patient. Okay. Here we go. Question number 29. An older patient asked a nurse to recommend strategies to prevent constipation. All right. Which of the following suggestions would be helpful? Note, more than one answer can be correct. Select all that apply. Select all that apply. So now with select all that apply, it could either be one, it could be a few of them, or it could be all of them. However, it is rarely ever one, and it is rarely ever all of them. So what do we think that the answer choices are? Is it get moderate exercise, at least 30 minutes a day, drink 6 to 8 glasses of water each day, eat a diet high in fiber, all right, take a mild laxative if you don't have a bowel movement every day, eat a protein-rich diet. A, B, C. Easy as 1, 2, 3. Doesn't that make sense? That makes sense that, A, B, C, those all make sense because, Michael Jackson. So shout out to y'all. That's why y'all answered like that, because y'all love Michael Jackson. Okay, I appreciate y'all. All right, here we go. But the answer is A, B, and C. Yeah, bro. I really did that. I really did that. All right, that's what the hospital told me. First of all, wait, what did the hospital tell you? What happened about Michael Jackson? Oh, okay. Here we go. So health promotions and maintenance, which is 6 to 12% on the NCLEX exam. I'm so glad you did that. That was actually for me to do the answers like this. It was literally like a last minute thing before I got on here. I was like, man, let me see if I can kind of lighten up the load a little bit. All right. So a daily bowel movement is not necessary if the patient is comfortable and the bowels move regularly. All right. Moderate exercise such as walking encourage bowel health. As does generous water intake. A diet high in fiber is also helpful. Check on the usual patterns of elimination, including frequency and consistency of stool. It is very crucial to carefully know what is normal for each patient. The normal frequency of stool passage range from twice a day to once every third or fourth day. Dry and hard feces is common characteristics of constipation. I had a nurse that I worked with. She didn't poop. She pooped like once every 3 days. And I'm like, what kind of alien are you? But that was just her norm. I think one day, don't do this, okay? But one day I don't know what it was. It was like some type of supplement that we took, and it was like a challenge, and we wanted to see who could hold it who could hold it the longest. Listen, some things that we did in the Navy were actually just amazing. All right, so who could hold it the longest, and whoever could hold out, they won like lunch or some shit like that. It was wild. So, but don't do that. Don't do that to yourself. All right, but here we go. Question number 30. A child is admitted to the hospital with suspected rheumatic fever. Which of the following observations is not confirming the diagnosis? All right. Not confirming the diagnosis. You're very jovial, which is nice. First of all, I have never heard no one call me jovial ever. I've never heard that. So the extent of your vocabulary is already astonishing to me. So that's number one. Number two, thank you. I appreciate it. Is it A, reddened rash visible over the trunk and extremity? Is it B, a history of sore throat that was self-limited in the past month? Is it a negative anti-streptolysin O titer, or is it an unexplained fever? What do we think it is? What do we think it is? Shout out to all 67 of y'all out here rocking. I appreciate y'all hanging out with me here on this Friday. We got a long weekend. You could have been anywhere else, but you're here with me because you're trying to get your learn on, and I appreciate that. Ashley is already a full-fledged nurse, and she's still up in here participating. So, Ashley, you already know the deal. You got to share this with everybody. Everybody. All right? So, what are we thinking? What are we thinking? We got A's. We got some C's. We got some C's. Bella. Shout out to you, Bella. I don't think I've seen Bella answer at all today. So shout out to you. Jenny from the block telling me C. All right, here we go, y'all. Let's see what the answer is. Here we go. In 3, 2, and the answer is C. The answer is C. So rheumatic fever. All right, rheumatic fever is caused by an untreated group AB hemolytic streptococcus infection in the previous 2 to 6 weeks. Right, confirmed by a positive anti-streptolysin O titer. Right, so an ASO is a test used to detect streptococcal antibodies detected against streptococcal lysin O. Okay, an elevated titer is proof of a previous streptococcal infection. It is usually more elevated after a pharyngeal than skin infection, while the ABD is typically elevated regardless of the site of infection. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. All right, 11 to 17%. My man Jason, hey, dance the night away, my guy. That's what I'm talking about. All right, so shout out to y'all. Oh, it's asking caused by. Yeah, see, Kiki, read the question or you're gonna get it wrong. Okay. All right, no more of that. So shout out to y'all for getting the answers correct. All right. Hey, ladies and gentlemen, make sure you guys go over there and get your free download. All right, get your free download. Me and Amber got some stuff coming up for y'all. All right, we got some good stuff coming up for y'all. But the first thing we wanted to give y'all was, a little something to help you understand the client needs for the NCLEX. All right, the step-by-step. There are 8 client needs sections that you need to know. This is where the National Council, this is how they pull their questions. All right, and you need to know that. So why? Because we want to. So make sure you go over there. The link is in my bio and my link tree. It is the very top one. All right, and it says understanding client needs for the NCLEX. All right, so go over there and get it. Ladies and gentlemen, everybody knows my struggle, right, of how I failed my NCLEX 3 times and I passed on the 4th. So I wrote a book about it. The book is called Conquer It, The Journey to Passing the NCLEX. It will be available to everybody June 5th of this year, which is my 4-year anniversary of becoming a nurse. This book tells you about how my struggles were when I failed, what I used, and then what finally worked for me when I passed. All right. It's about motivation and inspiration. It's about telling you to get out of your way. And if there's anything that I've ever done for you, if it's a live, if it's the course, if it's a DM or anything, go get, support your boy. Go check it out. All right. You can go pre-order it right now. You can pre-order the Kindle version. You could pre-order it anyway. If the paperback version has not popped yet, which I don't think it has, you can switch your pre-order. You can always switch your pre-order before it comes out. All right. So you guys can go over there and check it out. The book is going to be retailed at $29.99, right? Or is it all serious? What do you mean? Do you still have fun as a nurse, or is it all serious? Me personally, Jason, I always had fun. All right. And you always got to find those people that are always going to be a part of that for you. All right. So you can always find your own tribe. But think about it. Working as a nurse does not mean that you have to work bedside. Working as a nurse does not mean that you have to work bedside. I don't work bedside anymore. Right. But am I still cool as a nurse? Yeah. Am I still here giving you all this knowledge? You damn right. You know what I'm saying? Do I still enjoy my other nurse colleagues? Am I still friends with them? Absolutely. So it doesn't have to be. Remember that being a nurse is a job. It's an occupation, right? So you take that occupation, that career, the direction that you want it to go. All right. But you guys can go over there and pre-order that. All right. Support your boy. You know what I'm saying? I do this for y'all. I really wanted to get this story out there because, hey, somebody needs to hear it. We all have a story, and I'm telling mine. Hey, and I'm an award-winning author. You see what I'm saying? So y'all go check that out. Hey, and of course, ladies and gentlemen, that is a wrap today here on this Friday for doing NCLEX questions. All right. That is a wrap today of us doing NCLEX questions. I appreciate everybody participating. I appreciate all the likes. I appreciate all the shares. I appreciate all the gifts. While the gifts are not mandatory, they are so appreciated. So trust and believe me when I tell you thank you, and I appreciate y'all, and I love y'all, and I want y'all to go out here, and I want y'all to conquer in anything that you guys are doing. I didn't have to ban anybody today, and if they do get banned, just know that it is deserved. Sometimes it's not, and I just want to be petty because I'm just like that. So I didn't have to ban anybody today. So shout out to everybody once again. Go. These questions are off of nurseslabs.com. They are free. Free, right? They are free sets of questions. You guys can go over there and check them out for yourself. All right. Once again, you can pre-order Conquer It. That link is also in my bio. Cheryl, you are welcome. 7-day NCLEX course. It's $97, y'all. And if you go over there and you use my coupon right there, Memorial Day 2024, you'll get an additional 20% off. If you're still in school right now and you have another semester, like a summer semester, this is perfect for you. You see what I'm saying? Or if you don't graduate to December, it's perfect for you. Who else can say that you can get a full NCLEX review with all the updates that are going to be thrown in there for $67 or $97? You see what I'm saying? So go over there and check that out for yourself. Hey, like I said, if you need coaching, you need one-on-one coaching, because I do that as well. That link is also in my bio. Go to my website, fill out the questionnaire, and book a call with me, and let's see what's up. Hey, I have an ebook, right? That ebook is over 700 pages. When I tell you I went overkill, I went overkill. All right. You can go over there and check that out. That's in my link in my bio. And right now, hey, we'll do an Ask Me Anything. We'll hang out. What's up? Man, my eyes are all puffy. All puffy. All right. So what's up, everybody? I hope you guys all enjoyed that live, right? Let me see what's going on. I'm going to scroll back up and look at you guys' questions. Alex says, I graduate. Hold on, let me go back. Sorry. Is it IC? You take your NCLEX on June 5th? Hey, go make me proud and go get that license on that day. It says, pre-orders help gauge the first week of sales. Go help you, boy. Listen, Ashley, I appreciate you. I graduate in August. Shout out to you, Alex. I'm going to school. Oh, you're going to be a school nurse. Hey, go take care of those babies, because we definitely need to make sure our babies are taken care of while they're in school. I'm studying to be an LVN. Do you think we are real nurses? Absolutely. I don't come here. LVNs and LPNs, you guys they're the same exact thing. It's just dependent on location, right? So what I'm saying is, are you a real nurse? Absolutely. You take a license, do you not? You have a license, you carry a license. That's exactly what it is. So everybody needs to just be respectful and to everybody. Some people forget that. Some people have egos, and sometimes you have to check an ego. And trust me, I've checked a few egos. I don't care what license that you have or what board certification you have. You're not going to talk to me like I'm some random dude on the street. All right, you're going to respect me and you're going to respect everybody else. If not, then we're going to have a rough shift. It says, thank you for your service. Happy Memorial Day weekend, everyone. Thank you for your support. I appreciate you. Cheryl, you are welcome. Kiki says, thank you. First time joining. We'll definitely be back. Kiki, I appreciate you. Come back. Bring your friends. Bring Meemaw with you. She might want to hang out. Because that's what I'm studying. Yeah, absolutely. You are a nurse. You are very much a nurse. No, Leah, you are welcome. Alex says, I'm going to check it out. I take my NCLEX in September. I'm telling you right now, it is so relatable, because it doesn't matter if you've taken it once or multiple times. I've taken it once and multiple times. Right. And it's so relatable, like the feelings that you have, the anxiety, the nervousness, the fact of not wanting to go on. I talk about it. It says Kevin's sound is off. What you mean? Oh, hi, Kev. Nah, he's silly. I see. Hi. What's up? It says, do I need to look at every single topic? I'm getting overwhelmed studying a little bit. So what I recommend is start studying with the topic that is the most difficult for you. So for me, it was at one point, it was farm and it was maternal newborn. So do you want to go through all the topics? Yes. But you want to start with the topics that are the most difficult, and then you work your way through. Like if you know diabetes, like through and through, there's no need for you to start with diabetes. You know what I mean? So it says, amen. Yep. It says, yeah, you got this. I used to be a CNA and I enjoyed it. As to why I'm starting my nursing career. Jason, that's what's up. Like whatever works for you, man, like go that direction. All right. Yes, I'm so scared. Hey, the great thing? Here's the great thing about this book. This book will help ease your anxiety, because you're getting it from a perspective from somebody who is actively telling their story about them failing. Right. And then actively telling you what you need to do in that book in order for you to be successful. All right. It says, how do I start creating a study plan? So just like I said, start with the section that's the most difficult for you. So if it's farm, if it's peds, if it's management of care, do that. And then what you would want to do is, create that calendar. That's how you create a study plan. Crazy thing about it is, like, inside of the 7-day NCLEX course, I actually have a lecture called Creating a Study Plan. And it's about 16 minutes long, I believe. So, and I talk about exactly what you need to do in order for you to create a study plan for yourself. Did you ever use ATI? I did not use ATI. My A1, she did use ATI. She absolutely hates it. And she says use it for school. But when it comes to NCLEX, we don't use it. Just like HESI, I don't recommend people. I don't like HESI. I didn't like HESI at all. HESI didn't prepare me. A lot of people were like, "Oh, HESI's great," but HESI, like, get you something else, right? Get you something else. It says our maternal newborn professor was amazing. Luckily, because I thought I was going to struggle. Alex, that's actually good. Like, that is actually phenomenal that you had an instructor that was like very into making that happen for y'all, because not all institutions are built the same. What do you recommend instead of ATI when it comes to NCLEX? I recommend I recommend when it comes to the questions, I recommend Archer's questions, UWorld's questions, Kaplan's questions. Those are the three that I recommend. Now, when it comes to an NCLEX review, like if you want to go through NCLEX style questions, breaking them down, reading rationales, I recommend my course because I have two of them. I have one NCLEX review where I go through each client needs section, right? And like an hour or an hour and a half of like each section, and then I have a totally separate review where I go through the new generation NCLEX, where I go through 100 questions, and that's like almost a 4-hour lecture that's broken into certain parts, or that's broken into specific parts. So, it says I took my ATI comp predictor at the beginning of this semester, and it says I'm in the 95 percentile likelihood of passing the NCLEX. That's good. That's good. Do you do one-on-one reviews? I do one-on-one coaching specifically. Yes, I'm actually soon going to do away with one-on-one coaching, and I'm going to just be doing group coaching, and I'll probably be doing I'll probably start it off at maybe 5 at a time. And then move up to like a bigger group of like maybe doing it like 10 at a time, so on and so forth. But yes, right now I do one-on-one coaching. If that's something that you're interested in, you can find the link in my bio, and it'll say NCLEX coaching and mentoring. Alex says, do you think that's accurate or no? I've never used ATI. However, ATI is in the schools for a reason. Do I think the predictor works? Possibly, but I can't really speak on it because I personally have never used it. But when Amber gets on here, I recommend you follow me, Alex, and you follow her. She'll be able to be like, yes or no. But a lot of people swear by it. A lot of people don't. But keep coming to hang out with us, and they'll let you know. She'll let you know for sure. What do you think about Hearst? I have UWorld, but someone gifted me Hearst. So put it this way. All these reviews out here, they work, or else they wouldn't be out here as long as they've been out here. That's number one. Number two, does it work for you? Number three, when it comes to Hearst, it did not work for me. It didn't work for me. I had an older version of Hearst because I graduated in 2018. So I had one from like the review from like 2015. And it was really hard to get through her accent. Like I could not. She was just like, hey, y'all. It's kind of like listening to Registered Nurse RN, like Nurse Sarah. I love her. I love her content. I love all that stuff. But man, oh man, sometimes it's hard to get to that country accent, y'all. It's hard to get through it. And it didn't work for me. It may work for you. It may work for you. I've heard the NCLEX is mainly based off MedSurg. Is that true? MedSurg is based off, the NCLEX is based off of the 8 client needs sections. The ones, Jason, that we've been going over all day. All right. So remember, with management of care, they could fall under MedSurg. They could fall under psych. They could fall under pharmacology. They could fall under peds. They could fall under physiological adaptation when it comes to emergencies, critical and chronic. It really just truly all depends. All right. But just mainly based off MedSurg, I would find that statement to be incorrect. Alex, you're welcome. I followed you. Thanks, man. Anytime, my guy. ATI, no for NCLEX. There she is. Speak of the devil and she shall appear. Hey, here it is. My homie, my A1 since day one, Nurse Glamber, aka Nurse Amber. She is the NCLEX strategist. Right? She is the NCLEX strategist, and she says no for NCLEX. There it is. I don't like Hearst. Look, if you don't like it, you don't like it. You know what I'm saying? I used Hearst, but didn't like it either. Listen, I've coached students who have used Hearst and who have used UWorld at the same time, and they loved it. That was a combination that worked for them. You know what I'm saying? So what do you recommend, Nurse Glamber? So I'm going to tell you what I just told you about UWorld Archer. That's what she's going to recommend. She's going to recommend UWorld over everything. She'll recommend UWorld over Archer. But she'll recommend both Archer and UWorld. Yep, there it is. There it is. It's like I know, right? So she likes UWorld. I didn't like UWorld. I didn't like UWorld when it worked. It didn't work for me. And I used UWorld like 3 times. Can I talk to you? You're talking to me right now. What are we talking about? You're talking to me right now. What are we talking about? Is it BB? Oh, snap. Hey, so guess who else is in here, y'all? Hey, if you guys have ever had issues with the dosage calculation, even if you're in school, dosage calculation, the med math, listen to me. The queen of dosage calculations is in the building, y'all. Nurse C is in the building. She's the queen of dosage calculations. It's a party. I love it. I love having y'all up in here. It is a party. She is the queen of dosage calculation, and she reigns over her kingdom or queendom, whatever you want to call it. If you need help with med math, dosage calculation, Miss Lady right there will get you right. She is pinned. If y'all are not following her, if you're not following me, and if you're not following Nurse Glamber, what are y'all doing? What are y'all doing? Listen, there's a reason why y'all are here. Y'all don't just get me. And if you're not following Night Nurse 305 TV, which is one of our mutuals, Nurse Larissa, what are y'all doing? What are y'all doing? Y'all need to make that happen. Y'all need to make that happen. All right. Shout out to Kimberly. Thank you for the roses. I appreciate you. All right. What other questions do you guys have? Who was it? I think it was BB. Is it KY? Thank you for joining. Appreciate you. Hey, if you guys are just now joining, we just finished doing NCLEX questions. I get those NCLEX questions off of nurseslabs.com. They are free sets of questions. Maritza, how are you? You missed the live. I see. It says you said to look at all the topics, but I don't think I'll have the time. Let me tell you something right now. You better make the time. Everybody always tells me they don't have the time. You better make the time. You better make the time to go through it. You missed it. It's okay. It's all good. It says, how can I get good grades on anatomy and physiology? So I would recommend going to using Khan Academy on YouTube. Khan, Khan Academy on YouTube. Perfect. Predictor, what do you think? Yo, what's up, Echo? How are you? Hey, shout out to all 74 of y'all. Hey, so right now we're just doing an Ask Me Anything. Happy, we're talking about Memorial Day. Hey, by the way, the 7-day NCLEX course, y'all, I have an additional 20% off of already 70% off. You guys can go over there and get that. It is also linked in the bio. Go get that. All right. So what other questions do you guys have? I'm going to hang out for a little bit. Today is Friday. It's going to be a nice long weekend, a weekend of reflecting. All right. A weekend of reflecting. That's what I do every Memorial Day. So weekend of reflecting. I used to actually go and I used to put the flags on like the military hospital, the military cemetery that's here. And we used to do that every year. It's actually a really nice thing. If you guys have never got to volunteer to do something like that, it's really humbling and it's really nice. So if you guys ever do get the chance to do that, go try it. Go try it out. And all these side effects. What are we talking about? What happened? What side effects? What I miss? What did I miss? Thank you for your service. Remember those who gave it all. Absolutely. All right. Those that paved the way and those that'll continue to pave the way. You know what I'm saying? It says, I have a bachelor's, but not the license. What should I do to take the NCLEX? You got to give me a little bit more. Like, okay, you have a bachelor's and you haven't taken the license. Like, why? Are you from another country? Are you scared to take the NCLEX? Do you not know where to begin? Are you from another country and you haven't gotten your stuff through credentials, so on and so forth? Like, you got to give me a little bit more context. All right. I said, any tips for farm? Oh, so biggest thing about farm is that you need to know the family name and the suffixes, right? So we talk about the families, like what falls under cardiac, right? We talk about our cardiac meds. Think about A, B, C, Ds, right? So we have our ACE inhibitors, our ARBs, our calcium channel, our beta blockers, calcium channel blockers, A, B, C, D, DIG, diuretics, right? Understanding what are the suffixes, meaning the last portion. So I know a beta blocker is an LOL and an LOL is a beta blocker, right? So I need to understand, what is the pharmacokinetics? Is it an inotropic, chronotropic? Like, how does it move through the body? How does it affect the heart? Does it increase contractility? Does it relax the heart, right? And then you need to realize the safety implications of how it affects the patient. Like, what do we think? Like, what do we always do before we give cardiac meds? Vital signs. Vital signs. I need for y'all to hear me. Vital signs. All right. And that's how you start to remember them, right? Like what is our ACE inhibitors? They all end in pril, right? So think about digoxin, right? What's a really good important thing about digoxin? I need to hold digoxin if the heart rate is less than 60, right? So those are the things you have to know. What are the what are the expected outcomes, unexpected outcomes, when to give, when not to give, okay? I failed my NCLEX on Wednesday. Okay, so when are you taking it again? When are you taking it again? You're from Senegal? Okay, so here's my question to you, since you're from Senegal. Where are you at now? Like, are you in the United States? Are you in Canada? Where are you at now? You're better now? Okay, cool. You're better now. Because you know what I tell people when they're scared or they start feeling bad for themselves? I'm like, hey, if you're scared or anything like that, go to church. Go pray about it and then come back over here and let's figure out what we're going to do. All right. So you failed your NCLEX on Wednesday. You should get your breakdown soon, right? With that breakdown, you now have data. You have cold, hard data for what you didn't do. And it's going to show you, are you above? Are you near, or are you below? Wherever you are below at, that's where you start first. Says group study. Yep, for meds, that's another good one as well. It says hook 'em. Love the sign in the back. I appreciate you, Damon. I appreciate you. Alex, I would take an assessment. Okay, yep. It says pass my NCLEX yesterday. Lucy, you got some splaining to do. Shout out to Lucy. Hold on, got to screenshot that. Shout out to Lucy. Let's give Lucy a round of applause right now. Okay, let's see if we can do it. All right. Round of applause to Lucy. Lucy, welcome to the greatest shit show on earth, known as Being a Nurse. If there's a piece of advice that you could give to everybody out here, ma'am, what would it be? Or sir, or whatever I identify as, what would it be? And once again, congratulations to you and welcome to nursing. What else? It says medical calculation, how much is needed for NCLEX. In reality, for dosage calculation on NCLEX, you may get 2 questions, but medical calculations is important, period. And if y'all haven't been seeing what's been going on at Ascension, the Ascension hospitals, they got cyber attacked, so they couldn't even use the computer. So guess what? They were doing med math while they're writing it. They were writing their med math, right? No computer to do it for them. Nurse Cece, or a blessed RN, who is a dosage calculation queen, will tell you all about it because she has been going through it. All right, so but with regards to NCLEX, you may get 2. I have to wait 45 days now to take it again. Yes, you have to wait the 45-day dwelling period, right? And depending on what state that you live in will depend on how many times you can take the exam. So that's something that you need to be aware of too. Do you get the CPR report in the mail or email? So it all just depends. Some people get it email and some people get it mailed to them. And it just depends on the state. Use the report to study. There you go. Shout out to Ebony. Congratulations. And on my report, I had 4 below and the rest were near passing. So if you had 4 below and the rest were near passing, that means, all right, so now with the ones that are below, depending on which 4 that they are, which ones hold the most weight? Right. So let's just say if it's management of care, pharm, basic care and comfort, and like psychosocial, the one that holds the most weight is management of care. All right. And then you take it that way. Is it Jayla? Shout out to you, Jayla. Yes. You need tips to study. Okay. Tips to passing. Okay. Well, first of all, is it Vanessa? You really have to look within yourself to see what you are not doing right. Right. So think about it. Is your testing environment? Like, how is your testing environment, right? Do you sit here and you're just like, while you're over here trying to, freaking answer, like you're answering on your phone, trying to do stuff, right? Are you trying to do that? You're recreating the testing center. What accountability? What does your testing schedule look like? What does your time management look like? I bet you if I was to coach you right now, and I would ask you all these questions, probably not even half of them you would be able to give me an answer to. All right. So with that being said, this is where you have to audit yourself. You have to truly audit yourself. Okay. It says be confident and know that you got this. Exactly. That's exact. Lucy is putting y'all on game right now. All right. Don't second guess yourself. There you go. Love dosage calculation. She's going for RN. All right. Hey, so who was that? Who was that was asking that? I think it was Jason. So Jason, when it comes to doing LVN and RN, all right, while they are different tests, you learn the same content. You learn the exact same content that you learn as an LVN that you will learn as an RN. It's just the scope of practice that's different. You need to know what you can and cannot do as an LVN and what you can and cannot accept. I got a 70 on my ATI predictor. I'm going to take it again. Cool. Do it again. Shout out to Ohio. Oh, you got unlimited tries. I got the email. Okay, that's good. Is the NCLEX for RN? No, it's not. I just told you that. I didn't even see that. You're in the US? Okay. So is it Dinah? Is it Dinah or Dina? I don't know if I'm saying your name right. So the thing that I would recommend to you is is English, here's another question, is English your second language? It says no, none of those. It was psychosocial integrity. Analyzing cues, okay. Aloha, shout out to you. I study a lot, literally committed. All right, so now since you're telling me you're telling me that you study a lot, are you studying effectively? There's a difference between studying a lot. You could study and not go nowhere. You could study and not go anywhere, but are you studying effectively? And are you giving yourself enough time? A lot of people are so afraid that they don't have enough time. Oh my God, I'm going to miss out on that job. Hey, listen to me. Hey, I need for y'all. Hey, y'all follow Jordan. Y'all follow Jordan on on TikTok, right? He was just like, listen, hey, come here. All right. Y'all got time. Those jobs are not going anywhere. Those jobs are not going anywhere. Trust me. Will you think you're going to miss out on the job, another opportunity at another hospital or that same hospital later on down the line? If you need the time, give yourself the time. If you're coming right out of school, you need to be taking that ASAP. Why? Because all that knowledge is right here. All of it is right here. The longer you are out of school, the more all that knowledge is just going to start pouring out the back of your head. Okay. Do you think a new grad should start a med surg? Go to where you want. You do an audit of yourself and say to yourself, where do I want to go? Right? Now, do you want to go to med surg? You don't have to. You go to where you want. You go to where you want. I thought I truly still can't believe I failed. Listen, that's how I felt. And I failed 3 times. That's how I felt. And that's how I felt. So when you told me, I could put you on game right now. So the analyzing cues right now that you just told me, that's telling me that if I gave you signs and symptoms of what's happening with a patient, you can't tell me, you cannot identify what the disease process is. You cannot identify what your patient is going through. That's what it is. All right. We was told to take our NCLEX 29 days after graduation. Take your NCLEX ASAP. Take your NCLEX ASAP. You graduated April 25, April 26. Maybe I should have studied more. I take my NCLEX Wednesday. I feel like I am not retaining anything. Danny, did we have this conversation before? So that's another thing. Is it Katia? Hopefully I'm saying your name right. Vanessa. What type of learner are you? Think about that. What type of learner are you? Okay. Are you a read-write? You're a visual. Okay. So apply that aspect of studying. You're a visual learner. Okay. So apply that aspect of studying into your regimen. All right. Fun fact, 70% of learners are visual. 70% of learners are visual. All right. It says I need to do active recall. Is active recall, is that your way of studying? Who said that? Chris. Hey, Nurse Kevin. Hey, girl, what's the deal? I take my 4th test on Tuesday. That's what I'm talking about, girl. That's what I'm talking about. I'm so proud of you. All right. Hey, so when you go take that test, you better come back over here and let me know what's up. And you better write me a testimony and stop playing games with me, okay? Jason says, I don't know why, but I feel confident taking the NCLEX. I hope. Hey, this isn't Star Wars. All right. So don't hope or nothing. If you don't put in the work, you will not get the results, period. If you don't listen to me, I need for y'all to say it with me. If you don't put in the work, you will not get the results that you want, period. It took me 4 times for me to figure it out. And then on the 4th time, what did I do? I truly put in the work and I got a license. Y'all can do the same exact thing. All right. It says, I have highest grade in 2 classes. That's what's up. That's what's up. As a visual learner, I write every question down, and that's how I retain more information. So me as a visual learner, I don't write nothing down, right? So like for me, visually, I'm sitting here, like if I wanted to know how the heart worked, I would literally find that video, I would download it, and I would watch it over and over and over. And then I wouldn't write everything down, right? Because first of all, who wants carpal tunnel? That's number 1. And number 2 is I don't want to spend all this time writing, right? I want to be able to use my time effectively. So as I write, I start paraphrasing, and I start listening for the things that are keyed, that are cued, right? Analyzing the cue, right? Talking about ineffective tissue perfusion, or we start talking about, the cardiac perfusion, so on and so forth, right? You just got a new follower. I appreciate you. Thank you, everybody, for following Coffee Nuts. Appreciate the follow. I'm old school. I wouldn't necessarily say that it's old school because the learning abilities have been around for a long time. You just like to do it the other method, not necessarily old. So, what other questions do you guys have? Crisscross. I thought I saw somebody say something else. It says, no, med-surg, not my favorite, but my mentor said starting off in med-surg is ideal. Okay, there we go. So, once again, it all depends on where you want to go. Me, I did not want to go to med-surg, and I didn't. So I went to the ICU. Why? I wanted to go to the ICU is because I had already had a good understanding. I had already had a good understanding of critical care because of my background of being medical in the military, my 2 deployments, me being a teacher, and all those other things. So me going there and being able to pick the things up fast was okay for me, right? And so that's where I went. Now, med-surg, number 1, I'm not going to let nobody shit on med-surg because med-surg is a specialty. All right, say it with me. Med-surg is a specialty. You can get certified in med-surg, okay? Now, med-surg is at a slower pace than the critical care realm. It is. It just is. So it allows for you to really, really, really hone in on your time management. That is huge. Understanding your time management, right? Knowing your head-to-toe assessment, right? Understanding the most common medications that are given on that floor. It's a huge thing. It's a huge, huge thing. So do I think going to med-surg is bad? No. But do you have to go to med-surg? No, you don't. Any med-surg tips? I don't know. What exactly do you mean? Med-surg, are you talking about the class? Or are you talking about the, working the med-surg floor? What are we talking about? Shout out to all 49 of y'all. Hey, we just got finished doing NCLEX questions. Y'all got me to 44,000 likes, so I appreciate it. What other questions do you guys have? I was going to get off like 15 minutes ago, but y'all started slewing in with the questions. So what else? If you guys are just joining, my name's Kevin. I'm a registered nurse. Go Horns. Somewhere right there. All right, go Horns. I've been a registered nurse for almost 4 years. It'll be 4 years on the 5th. I worked ICU, OR, PACU. I was in the Navy for 16 years. I'm an award-winning author. I failed my NCLEX 3 times. And I'm here to essentially answer y'all's questions about, getting into nursing school, graduating, NCLEX, imposter syndrome, your first years of nursing, So what other questions do you guys have? Hey, make sure you guys go check the links out in my bio. All right. There's a bunch of stuff that's in there that's helpful for y'all, especially if you are on the journey to conquering this NCLEX. Okay. I don't care if you fail the NCLEX twice, 4, 8, 12, 20. I have talked to somebody who failed their NCLEX 20 times, y'all. 20. 20. Right? And put it this way. I'm just letting you know right now. If you are failing the NCLEX more than once, get a mentor. Get a mentor. Because it's insanity at this point. Who knows what the definition of insanity is? It's doing the same thing over and over and expecting the same results, right? So if you're failing more than once, what happens? Okay, what am I not getting? What am I not understanding? Somebody who has been through this, help me. And that's what I do. I do one-on-one coaching. right now. I'm going to group coaching at some point, but I do one-on-one coaching specifically for the NCLEX, right? Nothing, not for HESI, not for ATI, not for exit, not for nothing like that, but specifically for the NCLEX. All right. And that is what I do. I get people from point A to point B, right? And my biggest thing is that you have me until you pass. And that's what I say. You have me until you pass. All right. So I want for y'all to get it. I want for y'all to finally get out of your own way. Nobody wants to fail multiple times. Stop being hard-headed if you failed multiple times, and seek out somebody who is going to help, to show you, to be the outsider looking in, to show you what you're doing wrong so you can fix yourself. Period. That's what happened to me. I got to my third test failure and I'm just like, oh, why? And then I had a mentor. And that mentor guided me through the whole thing from beginning to end. And that individual is still one of my good friends, a mentor and still a good friend to this day. All right. So get out of your own way. Get out of your own way. If a mentor is not something that you want, hey, check my book out. It's coming out in June 5th. So what, like in 2 weeks, right? So, go check that out for yourself. Expecting a different result. Exactly. It says, is a med-surg job in the hospital more like repetitiveness? Just like any job, when you're there for a long period of time, you will see a good amount of how everything works, just like any job. That's exactly what nursing is, y'all. It is a job. It is indeed a job. Okay. So if you're on a med-surg floor, you will very much get these specific types of people, right? But I wouldn't think about it as being repetitiveness. Okay. You got to think, it's just like, what if you have a patient that comes in and then all of a sudden, you go in there and you've been working there for, let's say, a year, and then they die on you. That's not repetitive. And then you're not exposed to it. So you have no idea what to do at this point. You know what I mean? Med-surg indeed is a job, right? But you want to treat it as if when you're going there, you're going to learn something new every day. All right. You want to be able to learn something new every day. Nursing is an ever growing career field of education in all aspects. All right. Not just on the med-surg floor. The med-surg floor is a grain of sand on the amount of education that you get within the nursing realm. OK, what do you think about Pearson Trick? So I actually made a video. If you go to my YouTube channel, the Boot Nurse, or the YouTube channel, the Boot Nurse, a couple of years ago, I did it. I did the trick. And I don't think the trick doesn't really work anymore. The trick doesn't really work anymore. What do you think? Why did you repeat that? Like, you literally repeated that. It doesn't matter. But I did the trick because people were bugging me so much about it to show. I'll be like, okay, cool. However, the trick is not accurate. Listen to me. The trick is not accurate. All right. I have literally seen people get the good pop-up and fail, and I've seen people get the bad pop-up and pass. I hear people say, oh, it's a 99.999% chance. Like, stop it. Stop it. Just quit. All right. All it does is create more anxiety for you because you don't know. Until you see a piece of paper or something on Pearson VUE that says pass or fail, it's not going to matter. It's not going to matter. All right. Okay. So what tips for me now going into my second time? Katina, Vanessa, ma'am, I literally just gave them all to you. I just gave you all the tips. I was literally speaking specifically to you at one point. I literally gave you all the tips though. So you already got your breakdown. You know where to start. All right. Think about a review too. Think about your studies, right? Think about like your test taking strategies. Analyzing cues is huge, right? I should be able to tell you a set of vital signs and then start to tell you what the signs and the symptoms of what my patient is displaying. I should be able to tell you that. And in your mind, those damn gears should be turning. The cobweb should be coming off of them like in a grandfather clock, if those are still around, right? The gears should be going. You should be like, oh, that's this. Oh, okay, cool. Now, if you think it's that because the evidence is being presented to you, now I'm going to start to go down the line. Oh, okay. So like if I have a patient all right, let's think about this. I'm going to put you on game right now. I'm going to put everybody on game right now. And I'm just thinking about this off the top of my head. Okay. So if I have, okay, so you're the nurse, and I'm going to give you a case study, and I'm making this up as I go. If you're the nurse in the emergency department, a patient arrives from a motor vehicle accident. Upon triage, the patient's vital signs are as follows, or the patient's vital signs are as follows. Heart rate 146, or we'll say 136, respiratory rate 26, blood pressure 90 over 54, is pale and diaphoretic, and is unconscious. Based off of that alone, what do you think is happening to my patient? It says just graduated nursing school, Navy vet as well. Shout out to you, Brianna. You're thinking spinal? Are you sure it's spinal? Who said it? Ellie. Hemorrhage. No. Hemorrhage. We're thinking about hemorrhage. What? So this is what we're talking about, analyzing cues. Hemorrhage. We're thinking about shock. Thinking about hypovolemic shock. What did I say that was a cue to show that this person is hemorrhaging? Give me one of them. The low blood pressure. The cue was the blood pressure. The bleeding aspect, they're bleeding out. The pipes aren't piping. There's no volume, right? So we're thinking, I said, if you give me one, we're thinking about the low blood pressure. But yes, they are all correlated. The fast heart rate, right? The altered level of consciousness, the diaphoresis and sweating, right? But the low blood pressure, the high respiratory rate, right? Those are the cues that we're looking for, right? Those are the cues that I am looking for. Now, if I was to turn around and if I was to give you somebody who had a normal blood pressure, but they had a respiratory rate of 60, what if I just changed those two? If they had a blood pressure of 128 over 71, but they had a respiratory rate of 59, then what am I thinking about? With those cues, what do I recognize that as? No, not anxiety. Respiratory depression, respiratory, airway, respiratory. No. Pulmonary, no. Somebody said it in her earlier. Not respiratory. Not a respiratory. So our respiratory rate is at 12. Neuro, there you think about it, right? So what type I'm having, right? Because I have a normal blood pressure that's showing I am having my respiratory rate is on the downward slope, but it's still normal, but I have a heart rate that is low, which is, we're say 60 and below, right? Thinking about neurogenic shock, right? Those are the things, listen, the vital signs are important. Yes, neurogenic shock. The vital signs are important. That's why you have to recognize these. I need to know, as a basic nursing competency, I need to know that you're going to walk into a room, and when you do your assessment, I'll use Blanca, for example. Blanca is my patient. I'm going to walk into a room. Hey, Blanca, how are you? My name is Kevin. I'm going to be your nurse. And then Blanca doesn't respond to me. And I'm like, hey, Blanca, hey, can you hear me? Right? And then I go over there and I look at Blanca, and Blanca is pale. And then as I'm looking at Blanca and I'm trying to get her attention, I look at the monitor because I work ICU, right? So I have the monitors right there. I'm looking. Blanca's respiratory rate is below 12, right? Her heart rate is low, or her heart rate is extremely high. I work medical ICU, so her heart rate is extremely high, right? And her blood pressure is low. So she's unresponsive. So I'm just like, hey, can you hear me? So now I'm having a circulatory issue, right? The heart's trying to compensate at something's happening, right? And she's not responsive to me. Her respiratory rate is low. Her heart rate is high, but that heart rate's not going to stay there. She's going to decompensate in some way, shape, or form, right? At some point, hey, can you hear me? Oh, yeah, she's a code. You better press the code blue button. You better press that button. Could be sepsis, right? Could be septic, right? Could be septic. Because remember, the pipes aren't piping. Something's not working, right? And that's what I'm talking about when you need to recognize the cues. You need to be able to recognize the cues with your critical thinking, right? In order for you to make a safe nursing clinical judgment. That's what it's about. You can literally go to the National Council's website. You can literally go to the National Council's website and go to look at the 2023 NCLEX test plan. And it literally says the point of the NCLEX is to test a nurse's basic competency to use critical thinking in order to make a safe nursing clinical judgment. That's what it's about. Shout out to y'all. Shout out to y'all. And I talk about this all the time. Listen, I talk about this all the time here. And I talk about it inside of my course. If you don't have my course, you can get it for essentially 90% off right now. It's normally $397 and it's 70% off now for $97. And for Memorial Weekend, it's 20% off, right? It's literally an additional 20% off. You go in the coupon code, you put Memorial Day 2024, 20% off, boom, right? And so that's what you need, right? And the thing about it, when you're studying for NCLEX, listen to me. I am the type of person I'd rather you have it than not need it, than need it and not have it, right? A lot of people in school will be like, nah, girl, or no, my guy, just go get a test bank, bro, and you'll be okay. Yeah, but you don't learn like them. You don't learn like they do. You don't know how they learn. You don't know what they do after class. You know what I'm saying? You don't know how they retain information. Stop comparing yourself to everybody. Even though this test is about nursing competency and it tests everybody, remember, it is computer adaptive. So what questions that I get could be different or are going to be different than the ones that you get because it's based off of my competency, not yours. Retain, not memorize. Listen, the NCLEX, think of a pyramid, right? And there's 4 levels to this pyramid. The 2 levels that are below are like memorization, understanding, right? Those are not passing level questions. Where you want to be is that you want to be at analysis and application. You need to be able to analyze what's being given to you and then use that and apply it to make a safe clinical judgment. All right. Bree says, I need help. I've been out of nursing school since December. I need to take my NCLEX PN by July. Shout out to you. Hey, Nurse Cass is in the building, y'all. By the way, she works corrections. She will fight you. She is a mod. Or she'll ban you, whatever. I gave her that authority, you know what I'm saying? So shout out to you, Nurse Cass. Welcome. Makes sense. Right. Makes total sense. Exactly. So Vanessa, these are the things that I'm not telling you anything different that you can't go find on your own. What's up, Miss Sherry? How are you? Listen, I'm not telling you anything different that you can't go find on your own. You know what I'm saying? But if you're one of those people who want to get ready in the next 30 days, you can come work with me for 30 days. And you can see my glorious face all you want. Not really, but you can see my glorious face at least once a week for like 2 hours. You know what I'm saying? Come up with a study plan for you. Tell you where you need to work. Tell you what areas you need to fix. Do little small tweaks and peaks. Or, hey, we can make something drastic. Help you create a study plan so you know where you need to start for you. And if that's something that you want, you check that link in my bio, the NCLEX coaching and mentoring. All right. Thoughts on passing at 150 and failing at 85? Doesn't matter. It does not matter. Is it how do you say your name? Is it Riki? Riki, do you love me? I'm sorry. Oh, I'm sorry. My thoughts on passing at 150 is just as great as if you pass at 85. The stats show that people that fail at 85 are the same amount that fail at 150 or pass at 150 and pass at 85 and everything in between. Once again, it's all dependent on you. It's all very much dependent on you. Passed at 148. Look at that. Listen to him. He's the GOAT. I try to give out the best information I can out here. That's what I do. That's what I do. All right. What other questions you guys have? It says took exam today and stopped at 95. We have no idea. Oh, stop at 85. So there are 3 ways. There are 3 ways that you can fail the exam. or 3 ways that you can pass or fail the exam. Okay. Yeah, there are 3 ways to passing the exam. So you have what they call the 95% interval, right? You have the run out of time rule, and then you have the maximum the maximum amount of questions that you can get. Okay. The 95 percentile rule will show that your exam, it shows that the exam is saying that they are 95% sure by the time you get to the 85th question that you know this or you don't. But the 95, like once you hit 95% of getting all, the exam has to be 95% right, that you're just like, yeah, or the test is just like, yeah, they're doing good, or no, we're going to go ahead and we're going to stop it right here. All right, then you have the run out of time rule, which means that you don't meet the criteria, or your test shuts off on you based off of you running out of time. An automatic failure is if you don't meet the minimum amount of questions. So if it takes you 5 hours and you don't meet 85 questions, automatic failure. All right. So there have been people that have ran out of time and that still passed the exam. They will go back to your previous 70 questions or 60 questions. I forgot the exact number. And if those questions are above the passing line, then you'll pass. All right. I failed at 150. I was near passing standard on everything. So for you, what about on recognizing cues, Bree? I'm taking my first NCLEX on June 5th. Very nervous. Is it MCLO? Hey, it's okay for you to be nervous. It's okay. It's a part of that. It's a part of the journey for that. All right. But the one thing you need to realize is that, have you prepared? And if you've been preparing, because like I said, being nervous is a part of the process. You preparing for this exam and you preparing the correct way, you're going to be good to go. Like, you prepared and you're going to be good to go. All right. Numbers don't matter. I mean, you're right. The number doesn't matter as long as you hit your goal, as long as you hit that goal. I'm telling you right now, as somebody who has failed at 75, 265, and at 105, let me tell you something right now. I failed at 75. I failed at 265, and I failed at a little over 100. So I understand. All right. I actually have my performance breakdowns, and I'm going to frame them below recognizing cues. Okay. That's why. Below recognizing cues. So you mean to tell, if I was to write out a scenario, and I don't know if you heard it, if I was to write out a scenario, that's telling me you can't recognize what is happening with your patient based off of the data that I'm giving you. That's what it says. I'm paraphrasing, but that's what it says under the description of that. That's what it says under the description of that. All right. So what else y'all got? What other questions do y'all have? I might hang out for another 10 minutes. You know what I'm saying? Critical thinking. What about critical thinking? You need to use your critical thinking. Yes. Critical thinking in order for you to make a safe clinical judgment. Brooklyn, what are some good resources to study for the exit HESI? I know it's similar to the NCLEX. How do you know it's similar to the NCLEX if you've never taken the NCLEX, Brooklyn? So here's the truth about HESI, your exit HESI. You need to use what is provided to you with regards to HESI, such as Saunders and what Evolve or Elsevier, whatever that stuff that they get, because that's where they get their questions from. Your Best Grade is a good resource as well, but you really want to stick to where they write their questions. And Evolve, or Elsevier, I think that's what it is. That is where they get all their information from. And that's where they write their questions. All right. What's the best study resource for NCLEX? Madeline, I can't really answer that question because I don't know, I can't really answer that question because a lot of these resources that are out here that are good. Now, do you need a question bank? Yes. The question banks that I recommend is either Archer, UWorld, or Kaplan. We like those 3. When it comes to an NCLEX review, I recommend my NCLEX review, which is linked in my bio, which you can now get for 20% off right now, or 70% off with an additional 20% off if you type in Memorial Day 2024 in the coupon. But then you need to also understand what type of learner are you, right? You need to recreate your testing center. Talk about your accountability. You need to do your questions. Are you doing your questions effectively? So on and so forth, right? Can you use it for Yeah, absolutely. Yeah, it's for both RNs and LPNs. It is both for RNs and LPNs. Yes, you most definitely can use it for sure. All right. But yeah, there's a lot of resources that are out here. But Madeline, those would be the ones I would recommend. I was going to say that I think that it's a you question. What do you mean? Oh, you mean like it's what's based off of you, like you specifically. So yeah, how long should I study for? Well, Roxy, that's also another kind of crazy question. So I don't. Are you coming right out of school, right? How have you been studying previously to that? Have you been out of school for a while? Have you failed the NCLEX? But if you really want me to give you just a specific straight number, I would say to about 4 to 6 hours a day, consecutively. All right, consecutively. That you have to be consecutive and you have to be consistent. Listen. Don't be trying to go out here and study for one day and then put the book down for like 4 days and then go pick it back up and like don't do that. What about Saunders Q&A? What about it? What about Saunders Q&A? Chris, you still here? My goodness. What what resource do we use on recognizing cues? The Q Bank and your trainer. So when it comes to recognizing cues, if you're using my course as I'm going through the questions, you'll hear me start talking about things. You'll hear me start like what do I like? If you go in my review, I'll say the topic of this question is this. Now, this question is asking you not about this, but it's asking about this specifically. Right now, look at these keywords. Right now, this is what I talk about. Right. Happy Memorial Day, friend. Thank you for your service. Thank you for your support, friend. I appreciate you. So like I said, I recommend my course, like my review. But like if you decide to get a Q Bank, Archer's good, UWorld's good, Kaplan. We like those three. And if I say we, I mean me and Amber and Larissa. Those are the ones. Like that's the general consensus between the three of us. All right. But helping to recognize cues is understanding the content, because let's just say if we open up the MedSurg book right now and they start talking about, what are the signs and symptoms of somebody who has hypovolemic shock, right? That's like the content gives you the cues that you need to recognize. All they're going to do is pull that stuff from the book and then put it into a scenario or a story for you. You're going to be like, oh, okay, yeah, that's what that looks like. Yeah. And so, yeah, there you go. I use Archer. I love it. And I use Amber's training. Love it. How do you rate Saunders Q Bank? I didn't like Saunders Q Bank book. I didn't like it at all. Okay, let me rephrase. I did not like it for NCLEX. I did not like Saunders Q Bank for NCLEX. Didn't like it. It did not help me. Will it help you? Maybe. But I didn't like it. And it did not help me at all. It worked for while I was in school, but did not help. So, all right, man. All right. I got a few minutes. All right. What's the hardest class in nursing school, and how do you overcome the hurdle? So, the hardest for me, because I had a medical a medical background as an instructor, and I was a surgical tech, and I was a hospital corpsman for quite some time before I started nursing school. The hardest section for me was fundamentals. And the reason being is because I had worked as doing nursing things, and I was just hard-headed and I couldn't really get out of the way. Pharmacology, actually, I think I got an A in that class. How? No, only God knows why. Only God knows why and how, right? So, but I did well in pharm, and I loved pathophysiology. I loved that class. Like, I was nerding out in that class for some overly crazy reason. So the hardest class for me was fundamentals. Now, second hardest class for me was definitely MedSurg. Those two are what we like to call the nurse killers, right? Because those are like how they weed people out. And trust me, I saw so many people fail out of first semester and even a lot more that failed out of MedSurg, right? So the way to overcome that, one of the biggest ways to overcome that is to get into a study group. I'm a big person on working smarter, not harder, and utilizing the strengths of other people to bring together so we can all accomplish the same goal, which is to graduate, get a license, come out here, take care of people, make this money, and, ride off into the sunset like Thanos, right? So what I would say to you is to get into a study group, right? You, 4 other people, you and 4 other people, and feed off of one another, right? And then break the studying up into quarters. You do 25%, so on and so forth, right? Once you do that 25%, y'all bring everything together. We used to do everything in Google Docs. We would literally have a meeting once a week or twice a week. We talk to each other in a group chat. Hey, I'm doing this, I'm doing this, I'm doing this. And then at the end of the week, boom, put everything together. And you see how everybody's note-taking techniques are. Some people that gave a lot of information, some people that didn't give enough, but it was enough to help. And so now, but the majority of the work is done. So you could take it all and you can elaborate as much as you want at that point, right? Let me turn this on. Oh, okay, no, that's not bad. So you can elaborate as much as you want. So yeah, you can copy and paste. I don't care where you get it. Listen, you can go get it off like the off Quizlet if you want to, but as long as you fact check it. You know what I'm saying? Prioritization and delegation by Clarity. I've never used it. Wait a minute. Nope, I never used it. I'm trying to think. Do I got the book down there? So, but what's up, everybody? Hey, if you guys are just now joining, my name is Kevin. I'm a registered nurse. I'm going to be hanging out here for like another 5 minutes. Have you used Hearst before? Yes, Amber. I have used Hearst. Hearst did not work for me. It was just it was when I started using Hearst, it was probably like it was like the 2015 or 16 version or whatever. And it was really hard to get through that accent. And so it just did not work for me. All right. Can you give me a little bit more info on how I can create my own study calendar? I did already. I said, so create your own study calendar and start with the sections, right? So literally you could do it on a Google Doc or not a Google Doc. You could do it like on a Google Calendar, or you could do it on your phone. You could print it out and write it down. Got a whiteboard. You could write it. I got a whiteboard right here. You can write it down. You can have a calendar. You can write it down. And then like day 1, farm. Do a Q bank, right? And then you do that every day. It all just depends. I don't think you have my course, and this isn't me trying to tell you to get the course because I have a lecture that's in there. But what I'm saying is start with the section that's the most difficult for you and then put it on the day, right? And then put it on a day, like on Monday, you're going to do this. And then on Tuesday, what are you going to do the next day? On Wednesday, what are you going to do the next day? So on and so forth. Give yourself one day, at least 1 to 2 days off a week. No more than 2 days off, no more than 2 consecutive days off. Because by the time you hit day number 3, you're just going to be like, holy shit, I forgot that, right? So I don't want you to do that. I'm a little overwhelmed and I'm feeling like I'm not grasping it. Hold on, Amber. Let me see what you said. So I would recommend the same thing for you as well. And also think about what type of learner are you, Amber, right? So you feel like you're not grasping it. Also, by not grasping it, you're feeling like you're not able to retain it, right? So one really great way for you guys to retain your information, get yourself a good review like mine. I have it. It's linked in my bio, right? Also a Q bank, which I'm pretty sure you already have. And also think about what type of learner are you? Are you a read write? Are you a kinesthetic? Are you auditory? Are you visual? Are you a combination? Oh, so you're a combination. Okay. So what really helps you is reading your rationales, period. Reading your rationales. I call it RTFR. So I have 3 sayings: RTFQ, RTFA, RTFR, right? So when you're it all has to revolve around doing your reviewing aspect. Read the fucking question. Stop flying through this question. Stop flying through these questions like you got somewhere to go. Your only point in life, unless there's an emergency, is to have that ass in front of a computer, understanding why you got this question wrong, and then understanding why you got this question right. If you got it wrong, this is where you have to take the responsibility of going to find the answer, period. I want you to have your license. This is just a general statement. I want you all to have your license, but I can't want it more than you, period. I cannot want it more than you. So RTFQ, RTFA, read the fucking answers. If you don't understand what the question is asking you, go to your answer choices. A lot of the times the answer choices will tell you or help narrow down what the question is truly asking you. All right. I could literally throw a medication in there in my question, but I can literally throw a medication in my question, but the last part of the question won't even have anything it won't even say anything about it. You're like, oh man, I'm kind of confused on what it's even asking. Let me go to my answer choices. And then the answer choices have nothing to do about that medication whatsoever, right? So RTFQ, RTFA, RTFR, read the fucking rationale. Y'all act like y'all got somewhere to go. That's all I hear. Y'all act like y'all have somewhere to go. Like y'all are in such a rush. Oh, I don't want to sit here for, I did my quiz. It took me an hour and a half to 2 hours. I don't want to sit here and read this thing. It's stupid and blah, 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 blah. Well, the people that do that fucking fail. Sorry. You want to know the difference between professional athletes and people that are not at the professional level is that y'all only see them on Sunday, but y'all don't see everything that they have to do in between there for them to get there. And this is what this is. Your NCLEX is your Sunday night, Monday night football, or it's your Super Bowl. We'll say the Super Bowl, right? But nobody has any idea what you did during the season, the preseason or the off season, the preseason, the season, the postseason in order for you to get there. You see what I'm saying? So to all 58 of you, what are we going to do? Yep. Say it with me. Say it with me. We're going to read our fucking questions. We're going to read our fucking answers, and we're going to read our fucking rationales. Hey, right? That's what I'm talking about. All right. Hey, y'all. So it is now 8 o'clock. Y'all held me hostage, but I'm okay with that. LaShawn says, LOL, you yelled at me this. Oh, it's like you yelling at me. This just how I did the NCLEX. I bet that's my time. That's what I'm trying to tell you. I'm going to say it in my head. You better say it in your head. I'm telling you right now, speak it into existence. The universe will give it back to you. Okay. I'm going with your voice in my head and my NCLEX. Listen, I'm trying to tell you, you wouldn't be the first one to say, hey, I could hear you, Kevin, the entire time I took NCLEX. And that's something that I pride myself on. All right. I love being here for y'all because I wish something like this was here for me. I didn't even know if it existed or not. I don't think it did. So why wouldn't I give it back to the people? You know what I'm saying? This isn't like, something that I love to do. Like I'm obsessed at this point with trying to make sure that, y'all are my people. Y'all want to be nurses. I used to be a nursing student. Some of y'all are nurses out here, doing your damn thing. Y'all are my people, right? So who better to teach us than us? I'm an us teaching us, right? And that's what we do. All right. It says why I wish I had something. Exactly. That's what I'm saying. Nurse Cass said she wished she had something like this when she was in nursing school, and I'm here for it. Right. So with that being said, I appreciate everybody. I appreciate all the likes. Y'all got me to 50K. So I love y'all for that. No shameless plugs here because I'm not ashamed of anything that I'm doing. One thing before I get off here. Y'all protect yourselves from there's scammers that are out here, all right, that are going to prey on your emotional well-being when it comes to this NCLEX if you are unsuccessful at it, even if you're not unsuccessful at it, okay? Do not fall prey to these people. Nurse Meg, oh snap, Nurse Meg is in the building. I follow Nurse Meg. I like her stuff. I like your stuff, Meg. Meg. Shout out to you. You caught me right when I was getting off. So shout out to Nurse Meg, y'all. If y'all don't follow Nurse Meg, what are y'all doing? She's out here in these streets as well. It says, wish me congratulations in advance, please. I'm taking my NCLEX on Tuesday. You got this. I passed my boards on Monday. Hold on, Brooke. Brooke says I passed my boards on Monday. In my head, it's okay. If you don't pass on the first try. It is, listen to me when I tell you. It is not the end of the world if you're unsuccessful at this exam. I promise you. I promise you, it is not the end of the world. All right. So one thing I will tell you is that if you are unsuccessful at that exam, you got 24 hours to cry about it around me. And then next thing you know, I'm like, all right, cool. What are we doing? So you need to make it happen. All right. So anyways, like I said, last shameless plug, check out everything I got going on, right? Check out the link tree in my bio. All right. Hey, remember, I got this book coming out that I really want you guys to check out, especially if you're a repeat test taker, but it's for everybody to include people that are taking it for the first time. All right. I got an ebook that's over there to help you with NCLEX, over 700 pages, tons of pharmacology in there. All right. I got an NCLEX course right now. Right. And of course, if you're one of those individuals who wants one-on-one help, right? If you want one-on-one help because you don't understand what's happening in your world when it comes to NCLEX, it's for both RNs and LPNs Is it baby? A baby? Yeah, it's for both RN and LPN. If you're one of those individuals that you have a hard time and you don't know where to start, where to begin, understand NCLEX style questions, content, how to apply it, that's what the one-on-one coaching is for. Let me tell you something right now. If you failed more than twice, you need a coach. I'm just saying that right now. Because all you're going to do is you're just going to keep wasting time. And the one thing that we don't get back in this life is time. Trust and believe me that. All right. Life will pass you by. And that's the last thing that you want for yourself. All right. So last thing is, hey, make sure you take care of yourself mentally, spiritually, right? Emotionally, financially, of course, right? Because if you can't take care of you, you are no good to no one. All right. Can you explain the difference between RN and LPN? So it's about scope of practice. One's a registered nurse and one's a licensed practical nurse. Both have a license, but it's all about scope of practice. All right. That's the difference. They both can do the same tasks. I take that back. They can't do the same task based off scope of practice. That's what it is. That's the difference. All right. Take your exam on Tuesday. Shout out to you, Emily. You got this. I'll see you. Hey, we'll talk about it on Monday. Come do your thing. All right. So with that being said, ladies and gentlemen, I appreciate you guys hanging out. Go check out everything I got going on. Have a good, safe weekend. All right. And remember what Memorial Day is about. All right. Remember what Memorial Day is about. While you guys are out there, have your barbecue and doing all that good jazz. Remember what other people have done, in sacrifice that you probably will never, ever see. All right. So shout out to all my vets that are out there, all my brothers and sisters in arms that are still here, and those that aren't. All right. I think about those folks every day. So anyways, let me not get on this soapbox of this. I love y'all. I appreciate y'all. Thank you for your support, and I will see everybody on Monday. Bye.